I call to order the January 10th, 2022 Henderson County Board of Public Education Board meeting. Would all rise to say the Pledge of Allegiance with me, please? I pledge allegiance
to the flag
of the United States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. All right, first things first, we're going to do an agenda approval. I will take a motion to approve the agenda.
I move that we approve the agenda as presented.
All those in favor say aye. Aye. Any opposed? Make sure you have your mics on, if you wouldn't mind. Program highlights. Dr. John Bryant, take it away.
Thank you, Mr. Craven and members of the board. It feels as if we say frequently that we continue to live in ever-evolving and fluid times, and that is never more certain than it is right now as we talk about the conditions in our community, in our country, and across each phase of our work. The invitations were extended today to the medical leadership of our community to provide the Board of Education some context to understand what our community is facing, the work that's being done, and to give that context for the deliberations and the considerations that this board makes. Truly what makes us a strong community is our interdependence, our support, and our service to each other, and understanding what each of those elements are. And so we're very fortunate today to be joined by a series of medical leaders who are going to be here to provide some of that context and share some information with the board. I'd like to introduce them all at this time. They're sitting over to your left, to my right here. We have Dr. Natasha Lautenschlager, with Chief of Staff with Party Hospital. Dr. Chris Parsons, Medical Director of Infectious Disease with Party Hospital. Dr. Greg McCarty, Chief Medical Officer with Party Hospital. Dr. Richard Hudspeth, Blue Ridge Health. Dr. Teresa Herbert, Chief Medical Officer with Advent Health. And I cannot say how grateful we are as a school system and a school community to not just have your leadership and service in these ever-challenging times, but your presence here to share with us today. So thank you very much for being here with us. And so with that in mind, I've asked Dr. Chris Parsons to share some information from the board, and then we'll give an opportunity for each of those medical leaders to share with us. Of course, Mr. Steve Smith, yes, Amy Lynn Holt reminded me I need to say hello to Mr. Smith, who's here with us today, a continued steward of support for our school system and our community and the health department, and we're grateful for that leadership as well. So, Dr. Chris Parsons, thank you so much for being here today.
You're welcome. If you can hear me, give you a kind of review of what's happening in the hospital setting right now. Can you guys hear me okay?
Hold up.
Is that better?
Yep, there you go.
Thank you. I have no business on a stage normally. So. Everybody is kind of having a difficult time within hospital walls, as you guys know. That's no surprise, I think, to anyone here. Party currently has 34 patients within the walls, with many of those being within the emergency room waiting on beds. Bed situation is difficult at the moment. We've had to expand our ICU capacity, and so we're using one of the surgical step-down units to provide additional ICU level care for these patients, and that's a direct result of kind of the burden of the inpatient COVID situation right now. So the result of all those things is that we've had to curtail elective surgeries right now, both inpatient, outpatient elective surgeries, and that's for the foreseeable future, hopefully not much longer than a couple weeks, but we have to see how that goes. The result of a large number of cases in the hospital and staff outages has put a big strain on hospital staff. So the ratio of nursing to hospitalized patients has had to change. We've had to call in contractors to fill in spots of folks that are missing. Several things have had to close. Unfortunately, 2 urgent cares in our system as of today are not open out of the 4 that are normally available to test patients for COVID-19. That puts an additional strain on the community by virtue of increasing wait times for those tests. The tests themselves, fortunately, we've planned ahead quite well for that in a general sense, but the PCR tests in particular, there's a big national shortage of those. And so it's likely within the next week or so, we'll have to curtail PCR testing in settings that we normally use it. So for asymptomatic folks, return to work, return to school, things of that nature. And again, that's all the result of the increasing number of cases. The fraction of positive tests currently within our urgent care system as of late last week was about 50%. Dr. Aber can speak to Advent's situation there. It's about the same. So the numbers of cases in the community, again, that's reflected in the fraction of positive tests among all the tests that we're doing. So inevitably with this variant we're dealing with currently, which is Omicron, which within the UNC system, now based on data presented at the end of last week, approximately 80-90% of all the cases within the UNC health system are the Omicron variant. And so the case projection there is that we'll reach the peak of our cases sometime at the end of this month or early February. So the strain on the hospital system specifically will probably go on for a period of another several weeks. So all kinds of contingency plans are being made, contingency and crisis planning, and that relates to any number of things, including medications. Party's been lucky because we've been a hub for sotrovimab use. So we've been very aggressive about using the monoclonal antibodies. As of tomorrow afternoon, we'll be out of those antibodies. And that'll put an additional strain on patients in the outpatient setting. And we are in position to continue to receive those medications and to provide the oral medications when they become available. So those are all good things for the community. We just don't have enough of those medications to go around for the number of people who are currently infected. So that fact will continue, again, to put strain on hospital systems in terms of admissions and ED visits, urgent care visits, that kind of thing. But I think I'll stop there. I'm happy to answer any questions you guys have, or if there's an element that I missed that you would want to hear about the hospital, I'll be happy to tell you.
I have a question. I've read on the CDC website that the FDA was pulling the emergency use authorization for the PCR testing. Is that only a certain amount of the test, or is that all of them?
In other words, kind of cutting back on which PCR tests are available. Is that what you are?
Yeah, it's been in the news for a while that supposedly they can't tell the difference between the flu and COVID. Is that only a certain amount of them, or are you guys feeling like, no, those it can tell and they're working?
Yeah, that doesn't really apply to Part E or any other local hospitals. The tests that we use can detect Omicron. There's still a lot of unknowns about how sensitive some of these tests are with Omicron compared to other variants. But the ones that we currently have are not ones that have been considered problematic in testing. So we're not concerned about that locally here.
Okay.
Yeah, I know what you're asking. There are some PCR tests that are not designed to look for different elements of the virus that would allow you to detect different variants. But we use tests within Part E, and the other hospitals do as well, that will detect Omicron. So that's not an immediate concern.
Okay.
Dr. Parsons, could you please elaborate on how our decisions at the school level are affecting the health community at large?
I think it's hard to make connections, directly sometimes in all these things. I think in the current situation we're in with what I just described to you in the hospital setting, then essentially every little thing might matter in terms of these very razor-thin margins we're on right now with beds, drug availability, and everything. We do see patients who, the patients themselves are pretty convinced that they caught the infection from their children. Their children were sick first, and then they're at home with their children. And it's true that, and staff too, yeah, so it contributes to staff outages, that's right. So whatever can be done to kind of mitigate infections in the public in a general sense, and that includes schools, may help the hospitals, manage the current situation a little bit better, at least over the next month or so. Yeah, I think there's a time and a place to, kind of withdraw some of these mitigation measures. Just as we sit right now, I think if you ask people who work in the hospital, it's a tough time. And so withdrawing some of the things that may help, reduce childhood infections and therefore adult infections. Our goal here is to keep people out of the hospital.
I have a twofold question. How do you differentiate between the flu and Omicron? That's the first question. Secondly is, are you limiting your elective surgeries?
So second question, yes. So elective surgeries, both in the inpatient and outpatient setting, are currently on hold. And that's the result of the hospital situation right now with beds and staff outages and everything. The first question, it's very hard to differentiate between those two things, clinically speaking. So if you have a patient in front of you, the symptoms are very much the same, or they overlap enough you wouldn't be able to tell. We do have access, though, to on-site, what we call rapid testing, that can tell the difference, if you will, between flu and COVID-19. So the tests that we have available to us will help with that.
I have another question about the antibody treatment. So since we do have, I mean, I know there's not a ton of people here, but I know they're listening in. Can you expand a little bit on that? I dealt with the last, like when the antibody treatment for Delta was going out and you guys were waiting for the Omicron to come in. And I know I read maybe 2 weeks ago that this area only got like 20 of those, and the criteria's been way up for doctors to refer patients in to get them. Do you guys know, like, at a certain date you're going to receive? I know you said you're going to be out tomorrow and you're waiting for more to come in, but is it going to be more readily available for this strain?
Yeah, so the current predictions are that it will not be more readily available, at least for the next several weeks, because of the number of cases and the demand nationally. So Part 8 is in a position to receive a new allocation of drug at the beginning of every week. So that we would typically know that on Monday or Tuesday. And so tomorrow we'll probably have more information about that. The allocation is in general very small. So Part E at the height of the problem previously was treating approximately 30 patients a day with the other therapies that no longer work. And it's likely that the allocation we would receive would only be around 20 or 25 doses total. So
For the whole week?
Correct. So the result of that is that the criteria used to prioritize patients becomes much more stringent. And you really focus on the highest risk individuals, those of older age, patients who are unvaccinated because they tend to have the hardest time, and people with chronic lung disease and immune compromise. So the criteria is quite narrow, and that's not likely to change, at least for a few weeks.
Dr. Parsons, we get a lot of emails about the effectiveness of different types of masks. Some people have emailed us saying, well, we heard the cloth masks aren't good at all. And what could you contribute to that we could help people out with that info?
The whole data behind masks, I think it's fair to say we have very little information with Omicron specifically. I think the assumption, which is likely correct, is that cloth masks are less helpful because Omicron is so easy to catch. We already sort of knew that anyway for other variants. So a surgical mask like I have on currently, or a KN95 mask, for example, or N95, they have multi-layers, and there's charged material within those masks that actually attract particles away from your nose and mouth. So it's quite likely that eventually we'll know that those other masks are more effective than cloth masks. I think those of us currently dealing with the situation in the hospital, what we hope to achieve is that in most public places at the moment, that some sort of masks, are worn. So the best thing for kids likely would be a surgical mask if they could obtain one. So if my child were in school, that's probably what I would prefer. Yeah. I don't know if that's helpful to you.
That's very helpful. Thank you.
Dr. Parsons, we appreciate you coming up. We'd like to offer Dr. Hudspeth or Dr. Herbert, if you'd like to come up, please.
Thank you.
Herbert, welcome.
Hi, I'm Dr. Herbert. Some of you may know me from my time as a pediatrician in this community for the last 20 years. I've been a CMO at Advent Health for the last 3 years. I've been riding the wave of this pandemic along with all of you. And thank you, Dr. Parsons, for your great summary. I want to paint a very similar picture at Advent Health. We are a smaller facility. We're licensed for 6 ICU beds. We currently have 12 patients on ICU with COVID, and 10 of those are on the ventilators. We've had to be on critical care diversion for several days now because we don't want to take a patient on that we don't have a ventilator for. I'm happy to say, as of this afternoon, we heard from the state that we'd get some more ventilators, and now I'm working with our CRNA staff, that's our staff in the OR, to help support additional ventilators as they become needed. we're expecting this surge to continue to go up in the next 2 weeks. So I'm sure we will be using those ventilators. I know that all of our local hospitals and regional hospitals have been on transfer closure for many, many weeks now. So the 2 hospitals in your community are supporting you as best we can. With regards to our testing positivity rate, we are close to 50%. We did 311 tests on Friday, and 41% of those came back positive on Friday. The test positivity rate continues to climb each day. So we know we are riding this very, very steep wave. Our issues are space, ventilators, and staff. As of 15 minutes ago, I have 59 staff out on quarantine, working mainly in clinical areas. Some of them are quarantined because of infections within the family, and some of them have COVID. I have 5 physicians out right now with COVID. 2 of them are my hospitalists. Those are the doctors that take care of the sickest patients. 3 of them are in primary care. Now, fortunately, we can do telehealth visits if those doctors aren't too sick, but it's affecting all of our service lines.
Can you just give us some comparison? How many employees do you have? Do you know that off?
We have about 1,200 employees.
Okay.
This is the highest number I've ever seen. During the winter surge last year, we had 54 was the highest number of people we had out. We've already touched 60 last week, and I see that continuing to rise. And fortunately, those staff members aren't too sick. They, for the most part, have been vaccinated, but they cannot return to work until they've been cleared. So it's putting a huge burden and a safety concern on our hospital. This weekend, we did an all APB for any kind of help. We pulled in anyone we could, redeployed them to our ICU, to our ED, to serve as runners, cleaners, phone answers, whatever we need to do to support the clinical staff. We also redeployed staff from other areas up onto our ICU to support that very high acuity of patients. So that, I just trying to fill in the gap, Chris. I could say the same that Chris has said, but we're in a very similar situation. We are still doing elective surgeries as of today, but I anticipate that as the week goes on, we will have to pull back because of those staffing needs.
I had a question for Dr. Parsons, but I'm sure you can answer as well. And I should know this, but I don't. With public schools, there are positive cases, and then there is contact tracing.
Mhm.
In your situations with the closures, is it just positives, or do y'all have contact tracing as well? When you close like urgent care, because of is everybody positive, or are some people awaiting tests?
Some of the people right now are awaiting tests. We'll have those results back either tonight or tomorrow morning. But unfortunately, it used to be that you could clear them and then went back to work the next day. But unfortunately, because of the extreme contagiousness of Omicron, most of those people who've had that exposure are coming back positive, and then they have a 5 to 10 day quarantine at home. And of course, they're sick, so they need to stay away from the rest of the staff and the patients.
Dr. Herbert, I have a couple questions for you.
Mm-hmm.
You know, for us on the school board, it's mask versus no mask in our schools, right? And
Mm-hmm.
a lot of what we've said, and looking at the mask that you're wearing, our kids clearly aren't wearing masks that effective,
Mm-hmm.
Nor are they wearing them appropriately all of the time.
Mm-hmm.
And so at this point of the curve, does it even matter that those kids have masks on or not?
I'm afraid I'd say yes. The answer is yes, because we still have at least 2 more weeks of the climb in this curve. So if we can stop even 10% of the transmission that would have happened without masks, we're going to be ahead. So I know that masks aren't 100% protection, but some mask is good. And if you can get universal masking in the classroom, then it will help slow the spread. And then I'll have some nurses, because a lot of those kids have parents in healthcare, and the parents may not initially be sick, but they have to quarantine when their child is sick.
Is that the consensus from everyone here? Okay, thank you. Questions for Dr. Herbert in this case? Anybody?
Okay,
Dr.
thank you
Herbert,
very much.
Thank you so much.
Welcome.
Hello, everyone. Thank you for letting me speak. I'm going to try to wing this. I'm a hospitalist. I'm what she said. They don't let me out. I take care of patients who come to the hospital. They don't want to see me. They have to see me. They don't have a choice. They come in through the emergency room, through Dr. McCarty's group, or through her emergency room. They may have pneumonias. They have heart attacks. They have strokes. They have cancer. They may be coming to see me to die. And right now, there's a lot of COVID. And in fact, I can tell you a story about what's going on with our group right now. We have an unprecedented amount of patients in the hospital. We're unusual. Not a single one of our hospitalists is sick. Not a single one of my group is out with COVID. Yet I am here working when I shouldn't be because our census is so high. If I could half the COVID patients, I'd be a little bit more normal. It'd be more like a winter surge, not a COVID surge. We take care of autoimmune diseases. We take care of patients who have transplants. We are in an unusual situation where patients come to us and think they can come to Pardee or Park Ridge and transfer to UNC for those dialysis or for the heart care or that stroke care. Those days are over. They've been over for a while. If you come to see me and I can't take care of you, I have nowhere to send you. And I'm very worried that that may happen to our children. When our hospitals are stressed like they are, it's not a bang. Our proud buildings will still stand. Our proud physicians and our nurses are still working. But what happens is the wait in the emergency room goes longer. Your father with chest pain may be seen in 6 hours when there's more heart damage, or maybe 8, or maybe 12. And when a child is stung by a bee and needs urgent care, they may be sitting in that emergency room with a room full of COVID patients and a room full of stroke patients, and it may be a day. That's how a healthcare system goes under stress. Pain medications take longer. Surgeries aren't done. It's not with a bang. We go with stress with a whisper, and many people don't see it until they come into our walls, and they don't want to come into our walls. And I'd rather not be busy because that means all of you are healthy. So my request, and I was just texting with my husband because my child, who is autistic, she wears her mask every day because that's part of her routine. And we all know with certain children, you don't mess with routine. She'll probably wear her mask when there's no masks. But I have to wait and see if she's positive. And if she's positive, you may take me out of hospital. And if that happens, there are 20 people here with strokes. There are 20 fathers and mothers and sisters here with cancer and heart attacks and COVID that are now one doctor down. That shouldn't have to have that. So I'm asking you as a community if there's anything we can do to slow the spread or lessen the spread, if you can take 2 people off or keep me in the hospital longer so I can take care of your parents. That's what I'm asking. We don't struggle and bang. We don't struggle with screams. We don't riot. We don't march in the streets. We quietly do our jobs, and our patients wait and wait and wait. In our group, we've actually told patients and we've told our own families, make sure your kids have EpiPens. Because I don't know if something's going to happen, how long it's going to be. Those Christmas decorations, don't take them down. Please don't get on a ladder. Because I don't know what kind of surgeries we're going to be able to do. We may just splint you and wait. That's unusual. That's not normal. And anything that we can help, we are trying. And we ask you anything you can do to help, that helps. A hospital doesn't live on its own. A school board, a school doesn't live on its own. We're a major part of the economy of our community. We employ so many people, and so many businesses work with us. Goodness knows that a lot of us hospitalists have been surviving on Uber Eats and delivery and everything else like that. So we're all interconnected. It's all for one and one for all. Even if you don't see me, even if I'm invisible, I'm still working for you and you're working for me. And that's what I'm asking.
I have a
Yep.
question. Oh, sorry, Robert. So, and I never thought about this until I had a school visit last week and was speaking with a teacher that had had COVID. I think he told me it was in October. Well, it's actually an administrator. It wasn't a teacher. And he said that it was in October and he got his positive test and his doctor said, go home, stay home, don't go anywhere. His physician wouldn't see him. And you hear about that all the time that, that go to urgent care, don't come to the office. And I wonder how many, if our physicians would start seeing COVID patients to treat them, how many of our ERs would be lighter than what they are and hospital beds would be freed up because these patients aren't waiting until day 9 when their oxygen is at 70% and then they have to be admitted into the hospital. Is there going to be a switch anytime soon to where regular doctor's offices are going to start treating? I know some do, but a lot of them don't treat COVID patients.
So let me split the question up. The first question is, how many patients would not be in our beds, in our emergency rooms, if our physicians and our nurse practitioners were open and we're seeing these COVID patients in their office? From my experience, as of right now, 0. That's for the entire 18 months of this pandemic. 0. There are some things an outpatient physician can do, most notably now with these new medications. Dr. Parsons can give you more updates on those. They are difficult to get, but they are doable. It is a potential game changer, but they're not at every pharmacy. We've got very limited doses. We don't have enough doses to treat everyone in the United States who may need them. So those are going to be tricky to come by. But I want to emphasize, there is not a single person that is in the hospital or has been in the hospital with COVID that an outpatient visit would have prevented.
So if they were treated earlier,
Now,
I think that was part of her question.
Yeah,
They were
like
treated
if they had
earlier.
had nebulizer treatments or whatever earlier.
Nebulizer treatments will not keep a worsening COVID patient out of the hospital. You know, jump in here.
My wife calls me a mumbler, I'm sorry.
We've got to let everybody in
Yeah.
internet space, let them hear you.
As time passes, we're going to have to get used to living with this, and it would be much better for the community to have multiple test sites and availability of medications right then and there. I completely agree with that. This week, we've had conversations about trying to expand into our outpatient clinics. There's some hesitancy to do that at the beginning of the pandemic and as time passed in an effort to try to keep sick people away from well people. That's not easy anymore with Omicron being everywhere. So I think now's the time to consider that. So literally as of today, Party had discussions with some of the vendors for the tests and our outpatient administration to try to expand testing into the clinics. It's not clear when that will occur because this is a bad time to sort of ask vendors for more tests. There are natural shortages of the tests.
Right.
But I agree with you, probably within the next month or two, it's likely that there'll be a greater number of clinics which can deal with this, much like they deal with everything else, throughout most years, whether it be flu or colds. The testing is also quite good, so you're not really falling off in terms of the quality of testing in the hospital versus a clinic. So some advances that have been made in that direction are really helpful. So I think your point is well taken. We're probably a month or two away from doing that within the Party system at least.
And I know like Hendersonville Pediatrics, that's where I take my kids and they have one entrance for sick and one entrance for well. I get it. I don't want to go to my doctor's office for my yearly checkup and then get COVID because I was with a patient in the waiting room. I know it's difficult.
But just to go emphasize then to when I was saying 0, what I meant is we didn't have that pill, that the FDA approved pill that treats COVID until what? last
Yeah.
week. So so please take my response in context to that.
Okay.
Yeah, I just wanted to add, I'm Greg McCarty. Unlike Dr. Herbert, I've been the CMO for the last 10 days. But I have been the head of the emergency department for the last 10 years. So, to reiterate everything they've said is, this is a problem that just backs up the whole system from the back end all the way through. Staffing can't take care of it. But to add on to the outpatient clinic, we were on phone calls and having discussions this morning about how that's a longer lift. It's a heavier lift, a longer haul solution. But as Dr. Parsons just said, this is going to be with us. And we are trying to shift, testing and therapeutics to the outpatient providers. I think it just wasn't feasible at the beginning because the treatments really weren't amenable to doing in a doctor's office. So we had tried to funnel all our sick folks to one side and all our testing to one side or the other. As we move forward, we're trying to move those forward. So just to add that.
Approximately what percentage of your patients that are admitted into a hospital setting are of school age?
Here, not many. I mean, I don't think, do we have? We don't have a strong pediatric presence. We have a step-down pediatric, but we don't take care of sick kids. Those are all kind of transferred away. So I would say in our walls, there are very few pediatric patients.
Do you know how many you've,
But
Families who tell me, I visited my grandchild, I did this is where I got it from.
Right, I think if you were talking to a pediatric hospital like Mission Health, that question would be very different, or the answer to that question would be very different.
do you know how many you've transferred from party to
Uh,
mission?
No, I don't have that figure. It has not been a huge number, though, to be fair.
It seems to me that, especially with y'all, and I know with us, like a program like Test to Stay would be huge, rather than sending a lot of people home awaiting on a test that may be positive or negative. Allowing these people to still do their job would be huge. Are y'all planning on using that in the future, or is that just a school thing? The Test to Stay, just something like that sounds like it'd be very valuable to our medical community.
I might lean on Chris a little bit for this, but I think logistically, it's a very difficult thing for us to do and cost-wise, but.
Yeah, so you mean kind of test, just somewhat at random or screen folks, and then if they're.
Dr. Bryant, can you help me on that?
I'd be glad to. So the
Thank you.
conversation that Mr. Egoff is mentioning is one of the strategies that's being recommended to school systems is to employ a test to stay, which would eliminate students being under quarantine who are determined to be close contacts. So it allows them to be present in school so long as they're asymptomatic and they're taking a test through every 2 days for a period of time.
And they wear a mask.
Right, so they're required to wear a face covering during that period of time, but we're talking specifically about essentially a screening tool that monitors students if they remain in an educational environment.
I see.
Yes.
I think things like that are very reasonable moving forward in a general sense. In the hospital setting currently, there are implications for providers of being on certain hallways, for example, or in certain medical areas. If they're positive, then they're working with folks who are immune compromised or medically compromised, then there's a higher risk level there to some extent.
Well, I would understand if they were positive, yes. I was questioning maybe whether one is awaiting tests or contact traced and you weren't sure, that sort of thing. Those are the people that I would be.
Yeah, the employee tests that we use are what we refer to as rapid tests. So occasionally employees will go home and wait on the result, but in general, the result is available within a half an hour, 45 minutes. So they do get the result quickly if that's.
Are you testing your staff every day?
No, not in a broad stroke, no. There's value in doing that potentially to catch outbreaks. So that was a strategy used in schools, colleges, and so forth. The value of that currently with Omicron, the way this is moving right now, is a little bit less because Omicron is essentially everywhere. So if you do that strategy in a situation where you have short staff
Yeah.
with the intention of putting somebody out, they test positive, if they don't,
And you put them out too.
you're kind of hurting yourself staff-wise doing that.
Sure.
Yeah.
Sure.
But instead, we use mitigation strategies. That's.
Yes, that's why the masking and everything we do in the hospital helps keep the infections down. Yeah.
Thank you. Any questions for these two?
I wanted to check on the people on ventilators at both hospitals. I know there was 10 at Advent and I just wrote down that you're using the surgical step down for additional ICU patients. I wondered if all those patients were on a ventilator due to COVID, or if some have had heart attack and are on a ventilator or, whatever, or stroke.
At least from party's standpoint, we had 7 patients in the ICU earlier. 4 of those patients were on a ventilator. Those 4 patients who were on a ventilator, that was COVID related.
Okay.
And for perspective, our ICU is full of other ventilated patients,
Yeah, I was gonna-
ventilated but not.
Right, that's what I was gonna say.
Okay.
We had 6 this morning, 4 were COVID.
Unfortunately, our whole ICU today is COVID. That hasn't been the case the whole way through, but that's how it is today. And some of those patients are actually long haulers from the Delta surge. So the people that came in the middle of December, that, as you know, Delta attacks the lungs pretty severely. So we have some people who are kind of stuck here. We can't move them to long-term care facilities because there are no beds. So that has compounded the problem.
I'd like to invite Mr. Smith up.
It's like, please, no.
Yeah, come on down. How are you, sir? Thank you for coming. Really, just a lot of my questions are around your staff. The nurses that are doing the contact tracing, the quarantining efforts that we're going through, and simply the question for this board is mask or no mask at this particular point. That's seemingly what we can control. That's of all the other uncontrollables. And so I'd just like to hear from you what you need from us and what you're seeing and whatever else is on your mind.
Well, I, like you, appreciate the commentary that you've already achieved from the physician leaders. I've heard some of that, and that weight and gravity of that certainly resonates with me. I think one of the practical things I would say to you today is that I'm in touch with our school nurses constantly, and that is a particular public health staff component right now that is under extraordinary stress. We have also experienced staff shortages in that, despite this board's commitment to add additional positions, which have been incredibly beneficial during this difficult time. But I have 2 school nurses out today, either related to being a case or a close contact. And we're trying to rotate PRN school nurses in as fast as we can. That's a very dynamic position with acquiring nurses these days. So with this volume, it just compromises us, and some of the delay in testing results can also be problematic. So that model today in terms of case identification and then trying to identify all of the valid close contacts is very problematic for us today. I know principals and administration can probably attest to some of that complexity. I don't think there are any perfect answers for the days ahead. I do not envy this board's difficult positions with lots of things to weigh and balance. But I would agree with our physician leaders that if there is anything that we can do collectively to just slow the spread a little bit, that buys them time, and I think that's critical. We have seen what the surge looked like in other countries, and I think we braced for that. But the reality feels much, much different today. We've passed our Delta peak, and I do think we have 2 or 3 difficult weeks ahead of us. One of the goals that I absolutely agree with this board on is I want to keep schools in. And I think we're at risk or on the edge of compromising that commitment.
Sure. Yeah, we just closed, our second school is all virtual, Apple Valley Middle School. Flat Rock Middle School is also virtual, so we feel that as well. Any questions for Mr. Smith?
I might have a few. You knew that was coming, right? So I've been reading a lot, and from everything I've read, it says that the value of face masks is not anywhere near a surgical mask or an N95 or a KN95. I have been in multiple schools and in a lot of elementary classrooms when we have had masks mandated. And I will I mean, I can remember, I was in like 4 days in a row and counted 3 or 4 kids out of the whole classroom that had their mask on correctly over their nose and covering their mouth. The other 20-something kids, it was below the nose or down on the chin or, halfway falling off. And I just wonder for us to make a decision as a board to go and mandate masks again, what that will do to these children mentally and socially, because we have a lot of kids that are way behind socially because they've had almost 2 years of not seeing their peer faces. When they're going to basketball afterwards or to, soccer at the rec department, to dance, to gymnastics. And this is the only place that these kids are having to come in and wear a mask. Is it worth it to do that? Because it's very upsetting to, I would say, a great deal, probably 80% of the school community for us to do that when there's nowhere else in town, I mean, why aren't the commissioners being asked to do this countywide? Or why isn't the
Very good question.
health department from, North Carolina, why aren't they mandating it statewide? Why it's the battleground is here,
That
and
the burden's on us.
yeah, it's definitely on us. And, I don't want to ignore what physicians are here telling us. But at the same time, we have to look at the mental health of these kids and, what our parents are telling us and, what our staff wants. And so I'm just wondering, how efficient are we going to be at just masking at the schools when everywhere else in the county, except for if you go into a doctor's office or hospital, people have their masks off?
There was a lot there.
I know.
But I honestly, Mrs. Holt, I agree with almost everything that you said. I mean, it is a very difficult circumstance. And I, like you, wish I had that perfect calculator to plug those values in and to determine whether we're better off or not. I do think it is certainly true that if people are only taking precautions in the school environment and not doing that outside, that certainly compromises our community position. So again, I would concede readily that cases are happening even amongst children because of exposure risk outside of the school environment. We've seen that trend. But it is just an option for you to consider. When you think about the sole kind of objective of trying to reduce the transmission of disease, trying to limit the spread, and that's very difficult with this particular variant, you have to believe that there is some marginal benefit to doing masks. But I'm not weighing all those other considerations that are before you. And I know you hear about that from parents as well. And I think the only thing that I'm not certain about is where our community at large stands about it. I know you hear from a lot of people every day. Really, the emails and phone calls I get, my perception is it's about 50-50. And that divisiveness is probably the greatest threat in our community today, not the pandemic. And
Absolutely.
I regret that we're in that position, that any of us are. All I can tell you is whatever decisions you may decide, if you decided to do something additional, I think it's very short term. We just did not envision being in this predicament this fast. And honestly, I'm moved from concern to worried. I'm just honestly worried about people. But there is a lot to weigh, and I don't have a perfect answer.
A reoccurring theme that I keep hearing is about people that are positive, people that are awaiting results of tests. I may be jumping ahead, but in my mind, and I may be an outlier, but I believe COVID is never going away. And I may be wrong, and I hope and pray I'm wrong. But I feel that COVID will be here next winter, and next winter, and next winter. Just like the flu. And it seems to me we would all benefit more if we could figure out who's got it there. And I go back to test to stay. And who doesn't have it? And who needs it? This is a note from my girl today. They're contact tracing too many people. In one class today, 11 people were quarantined. 11 people. Now, are you telling me 11 people are going to miss 5 days? And are you telling me 11 people will be positive? I don't think so. So somebody help me. Where is the test to stay, and when are we going to start doing that? I mean, COVID has been here for 2 years, and I don't think maybe test to stay was just invented last month. But it seems to me as this is never going to leave, we've got to figure out how to keep people in school, how to keep people at work, not how do we quarantine them? How do we get them out of work? We need to figure out how to keep them in work. So what are we doing about keeping people where they're supposed to be, not taking them out of where they're supposed to be?
Well, I think one thing we can do is we can look at mitigation factors that we have control over, which it would be nice for us to have, and I'll take that back. I started to say it'd be nice if we had control over what happens in other places, but we do have control over being able to install some mitigating factors within our school system. And I've sat here and I've heard from the health community saying, it's not the children that are going to the hospitals, it's the parents and the grandparents of the children. And I want to keep our schools open. I understand that some kids are very opposed to wearing masks. It's bothersome. But I think it's much more detrimental to children to not have our school doors open.
Agreed.
I understand.
And so I think we've got to step up and say, until this surge, goes down, we've got to put on all the armor and layers of protection that we can. I think that's how we get through it and keep people at work and keep people at school right now.
And I think all of us non-MDs here have done a lot of reading about it, and we're wise to do that. But I'm looking at 6 or 7 people sitting here, first of all, who look absolutely exhausted. And I don't know when they stop being the people that we look to for medical advice and we start becoming Google MDs. I'm sorry, what they say is far more important to me than any of our opinions, including my own.
That's fine, but my question is still lays on the floor.
Yes, sir. So part of, again, your question relates to what strategies are we doing to mitigate
Yes,
the
thank
impacts
you.
of quarantine? And again, preserve face-to-face instruction and the daily use of that. Certainly as it relates to the program highlight and the expertise in the room, was to help this board have information that allows you to deliberate and discuss the choices that affect our operations, especially when, as you heard from these doctors, and we all know to be true, our interdependence is undeniable as it relates to the way in which we serve and support each other as a community, the way we receive care and we expect care and we provide education and serve. And so, to your point, there are a whole series of slides that you're familiar with that I will speak to as it relates to test-to-stay strategies, how we address the quarantining. Certainly, the case rates in our community have amplified that to a degree that we've never seen before. You'll see that in the slides as well, and as the medical leadership has helped. I think more than anything else, what we want to acknowledge is this board needs to have as much information as possible to make the decisions that are relevant and in real time. And the current time is different than it was just a week ago, just 2 weeks ago, in what we're seeing. And so I would just share a tremendous gratitude to the men and women who are leading in our healthcare community and who are present and showing up to work every day to care for anyone for any reason. Because I know that that's the one thing we are blessed to be able to take for granted is an excellent healthcare system that says we're here when you need us, no matter what. And anything that we can do to be able to support that, we certainly want to be present in that space. So I just say thank you to each of you for being here today.
Thank you very much.
Absolutely.
Wait, we're not
But
we're not done. She's got a question and I have two more.
Yeah, we've got a couple questions left, and then we'll get you guys out of here if that's okay.
Steve, my question's to you. Are the nurses in favor of test to stay, or is this, I mean, they are pretty well to their limit. I mean, they're overwhelmed with all that's going on, our school nurses. Are they in favor of the test to stay? Because it's going to be a lot more probably paperwork for them in the long run.
They absolutely are public health. Our department is.
Okay.
If we can avoid quarantines, that's what we want to do. It is a lift, and right now, there's definitely some capacity issues that we'll have to finalize in terms of being able to provide that. And it is a little bit daunting thinking about that implementation in the middle of a surge because volumes are so high. Those tests require testing on day 1, 3, 5, 7. I think that's it. So it could be a lot of volume depending upon who chooses to participate. Some people may choose not to participate with that strategy, again, because if you're able to return after that shortened quarantine of 5 days, you have to continue to wear a mask through day 10. But it makes absolute sense. To Mr. Egoff's point, testing is huge, but if you can't get results fast, and if you don't have testing capacity to make that happen quickly, it's not very effective. And you've already heard from our hospitals that their positivity rate is around 40%. So sometimes it's a question of be careful what you ask for because those results could be significant.
Now, when you say 40%, again, when they took the test, how long till they found the result?
It depends on the type of test, whether it's an antigen or a PCR. PCR test that we were doing last week is taking 3 and 4 days to turn around. So that's very little value because you could get out of quarantine if you're asymptomatic at 5 days. But that's true everywhere. Again, all of the demand happens at once, so the system just can't absorb it all.
I have another question, Steve. Should we give out masks besides the cloth masks to our kids?
I think whether you keep masks optional or you require them, I think there is value in providing higher level protective masks. I think moving to a surgical mask or procedure mask is the right way to go.
Okay. And our schools, are they the key to all of you guys of not spreading it, and of if we can't stay open, our schools, because adults get it or kids get it, that is going to so hurt you guys and so hurt our community. Do you agree with that, Steve?
I don't want to place that kind of burden on your shoulders, that everything rests on what you may decide to do or not do. You know already that you touch an incredible proportion of families in the community. So you end up being centric whether you want to or not. So it's just easy to talk about the school environment and in total what an impact that makes. But there have been very reasoned points made today that those exposures and cases happen in many places outside of the school environment as well. So I'm trying to be very balanced about that.
Thank you.
I got a text that said that one of my kids needed to quarantine, so I was kind of distracted when Robert asked earlier about the number of children, like how many children from Henderson County are being hospitalized, like up at Mission.
My last report, I think this was actually a WLOS news release last week. There were 9, but I do not know how many of those are
Henderson County. Okay.
Thank you.
Pediatric cases are being transferred to Mission Health.
I'd like to invite Dr. Hudspeth up to kind of wrap this up for us, if you wouldn't mind, from Blue Ridge Health.
Well, thank you. And I'm a family physician and the CEO at Blue Ridge, and Blue Ridge has been in the community now since 1963. So a couple of comments I just want to make with some of the things that were said. One is, what about doctors' offices being open? I want to let you know, we've been open since the pandemic started. We figured out a way to deliver care, and we've been there the whole time. We're also in the schools, and we're ready to assist and help with the health department, the work that they're doing in the schools, in order to keep schools open. We know that there have been mental health issues because of this pandemic. I'm not necessarily convinced, honestly, that it's just because people are wearing masks. It's because they're not in school. There's an anxiety
Sure.
out there in society, and we need to keep schools open as best as we can. I want to reiterate, the stay in school philosophy could be great if we were in an ideal world. We run out of supplies, we run out of people, we run out of test kits, we run out of all of these things. So if in an ideal world we had these things, then that would be a great strategy. But with that, we can still try and do those things that we have the capabilities of doing. But the question becomes, again, what are our mitigation strategies that we can do, that we can control? Now, we know that mask works, and I can't help when you say the burden is put on the students, and perhaps I will get in trouble for this, but just look around the room. How many adults here aren't wearing a mask that could contribute to what we're asking people to do and put less burden on our school children? So think about our own actions as far as what we can do as a community to help get through this next couple or 3 weeks. And if it is here to stay, sir, what are we going to do in 6 months when we got the Zeta variant, right? We need to start figuring out how we're going to deal with this, whatever it brings to us, and adapt to that ability to, is it a highly contagious one that's causing serious illness? Is it highly contagious? It's not causing, is it not really causing any illness? Is it not transmissible? It's going to keep throwing crap at us. That's the for sure. And unless we adapt to it, the virus doesn't care. It will adapt to what we do because it's a virus. That's what viruses do. So.
The last question that I have is, I don't know if you can answer this or if the hospitals need to answer. How many people in the hospitals are unvaccinated? Like not being treated for COVID that are not vaccinated? Is it the 90% that we've heard?
So I can leave that to them, but the email that I got today from Jay Kirby from the hospital says that 90% of those folks are unvaccinated.
Okay.
Would we be helping medical community if we were wearing surgical masks, if our children were wearing surgical masks? Would we be lightening the load on the hospital community?
You know, we believe so. Again, as Dr. Parsons said, do we have perfect data on how masks work with Omicron? Not necessarily. We think it's more transmissible, so the more leakage you have through a cloth mask that isn't several plies, several layers, and all of the other things that he talked about with the N95s, yeah, you're going to have that. But what I would say is don't let perfection be the enemy of good, right? You know, if we got a cloth mask and it can cut down on 10%, great. If you've got surgical masks that you can give out to students and staff, great, that's going to be better. You know, are we going to put everybody in an N95? I doubt it. We just don't have the resources to do that any more than we have the resources to test every single kid or however we're going to do it.
One more, if, and I don't know, we might have already discussed this, I'm not sure, but now, do we test every person in the hospital beside the fact? Let's say someone comes in with an ACL tear and needs surgery. Are they tested? And that's for all the hospitals?
No, we do not do that. We do preoperative for elective. We do preoperative for elective, otherwise it's for symptomatic.
So
If you come in with chest pain, you're having a heart attack, we don't test you for COVID.
but if you're in the hospital, if you're in the hospital, you do not test.
We cannot test everyone. We test everyone who may have symptoms of COVID, which is very broad, because diarrhea,
Right.
if we catch people who may be in the hospital for a heart attack who are positive for COVID because they, like coughing, for example, that
which does not include COVID, or does include COVID.
Just said.
Does include COVID, right. Yes.
Do we know what percentage of people in Henderson County have been vaccinated and have had the booster?
Thought you might ask that question, Mr. Bridges, and I did get some breakdown by age group. So today, 5 to 11, 16%,
Sure.
12 to 17, 37%, 18 to 24, 51%, and then it tiers on up, 54, 25 to 49, until you get to 75 plus, which is 89. That total percent for those eligible, I think it's around 58 or 59%. And as you know, boosters are incredibly important in this current environment with the variant.
What is 12 to 17?
37%.
Thank you.
And Mr. Craven, you've been so gracious with them. If you have other questions, I know they're committed to stay and answer those, but I know the demands on these people sitting here, and I want to release them as soon as possible.
Please. Thank you guys so much for coming
Thank
today.
you.
We
For everything
truly
you do.
appreciate it. Mr. Smith, are you going to stick around? All right, great. So we're going to move on. Dr. Bryant, do you want to move up?
Yes.
What we're going to do is I'm going to make a slight change to the agenda. I'm just going to move up the current face covering guidance and policy to right after public comment, if that's okay.
Yes, sir, be glad to do so.
Okay. Next is going to be board chair observations. I don't have any. Board member observations. Ms. Case.
Teacher at East High who has won an award. Her name is Ms. McDade, and she's one of 5 publics. She's one of the finalists for the math teacher state finalist. And then I don't know if y'all are going to hit on Dr. Bryant or not. He's won an award.
Lisa Bryant would not like for anybody to hit on me.
Oh, well, excuse
Important.
sorry.
Thank you, yes.
You can tap him gently.
He's one of 5 public school superintendents in Western North Carolina to receive the Extraordinary Public Service Award from the Land of the Sky Regional Council as part of their annual awards. So,
Well deserved.
That's a 2-month award there because we gave you the award last month with Dr. Volk, correct? Okay. Anybody else have any board member comments? All right, moving on. Public comments. We have 1, 2, 3, 4, 5, 6 today. Before we get going, so we're going to give the full 3 minutes, Matthew. Also, we received quite a few digital public comments as well as emails over the last couple of weeks. Here's the breakdown. We've had 144 comments since last Monday. We had 78 of those wanted us to reinstate the mask mandate. 50 of those wanted us to keep masks optional. 2 were asking for us to have an online learning option, virtual option. 1, return to virtual learning. 4 was no mandates in schools, period. 3 were no mandates, mask mandates ever again. 2, no mask mandates / stop quarantines. 3 were considered COVID safety precautions in school. And 1 was just an overall issue with the quarantine guidelines. So without further ado, we'll go ahead and get some public comments going. And the first is Shane McAnally. Welcome, sir. Did I say your last name correctly? Because I have to say it again.
McAnally.
McAnally, got
Nothing
you.
like it looks.
All right, perfect. 3 minutes.
So I have 2 kids in Henderson County schools, and I had prepared something to say, but just listening to the doctors and hearing what they have to say, I think they overwhelmingly kind of, I cook for a living, so me coming and talking about variants and mitigation. We have pulled our kids back, so they're doing remote learning, which any parent knows, not fun. So I'm just here to say that I sincerely hope you guys return the mask mandate to the classroom so my kids can go back. And I think the doctors, when I'm sick, I go to the doctor. I listen to what they say, and I think they were pretty clear with what they were saying today. Thank you.
Thanks, sir. Next up is going to be Kelly McAnally. Oh, I butchered it already, didn't I? I'm sorry. Yeah. Welcome.
Thank you. Members of the board, my name is Kelly McAnally. I'm a clinical social worker and a school-based therapist. My family and I live in Hendersonville, and our children attend Henderson County Public Schools. I'm here today to strongly request that the board reinstate the mask mandate in our schools to comply with the recommendations of the American Pediatric Society and the CDC. The data from the most recent Omicron variant indicates a significant increase in transmissibility from other variants. And the research shows that an increase in breakthrough cases where fully vaccinated people and children are becoming infected, and in some cases very ill or worse. The research from the CDC exhibits the effectiveness of mask wearing in preventing uncontrolled spread of COVID. The reality is that allowing children and school staff to attend without masks will result in increased infections and quarantines for all those who've been exposed. This poses a threat to our schools and communities in several ways. First, when infections begin to increase exponentially, as the AAP advises that it will, we will have less and less children physically in school, which threatens the school's ability to remain open for in-person learning. I believe that in-person attendance at school is critical for child development, academically, socially, and emotionally. Additionally, children without sufficient resources at home will suffer exponentially compared to other children when they're not in school. There are lots of cases where child abuse aren't being reported, children aren't getting enough to eat. Children need to be in schools. Mask wearing in schools is also critical to protect our community at large, as we heard earlier. As we all know, the number of positive cases within a community directly impacts the spread, meaning more cases increases the likelihood of getting infected ourselves. So we're protecting ourselves and protecting our community. Hospitals across the nation are already overwhelmed with COVID patients, and the hospitals are increasingly short-staffed as the variant continues to surge. Many people are unable to acquire routine medical care because of the extensive strain on the system. On a personal note, we have a kid with asthma, and we have medically vulnerable people in our family. We cannot risk sending our child to school even though she is fully vaccinated because of the potential risk to our family and our kid. Our family is struggling to be able to continue working while staying at home and caring for our child. Masking is a proven way to reduce the spread of the virus and has been successfully utilized before in schools for months and months to help schools remain open and protect children in the community. We believe that it's the responsibility of the board to follow the guidelines of the CDC and the AAP, as they are the experts in epidemiology and children's health. And they have the data to support their recommendations. We must take action to protect our community. We implore the board to please consider this request and to consider how inexpensive mask wearing is and how effective it is at slowing the spread. The board has the responsibility and the power to make decisions that keep our children safe. Right now, we are not feeling protected. Please help us keep our children safe and allow them to return to school with masks until this variant is less of a threat.
Thank you. Next up is Kathy Malin. Welcome.
Good evening, board. I am a resident of Henderson County. My two grandchildren attend school in the district, one at Atkinson Elementary and the other at a charter school within the county, which does require masks. While the charter school has, in my opinion, fulfilled its obligation to take all reasonable steps to assure the safety of our children, by following the CDC and North Carolina guidelines, I am hopeful that this evening, this body will require the same. My granddaughter has already had COVID once, transmitted to her by her teacher, who was not wearing his mask when there was a mask mandate. We are very concerned that exposure and transmission will occur again, given the precipitous increase since December 27th in confirmed cases and current hospitalizations. I therefore respectfully request and urge the board to approve a mask mandate until the heightened risk subsides, which, as we've heard, could be in a month, just a matter of 4 weeks. I believe it is your duty and role to follow the public policy recommended by local and national top scientists and educational experts, some of who you heard from tonight, as set forth in the CDC guidance for COVID-19 prevention in K-12 schools, the linked science brief to that document. And in North Carolina, the North Carolina Department of Health and Human Services, which just updated their guidance on Friday through Strong Schools North Carolina and their public health toolkit, where it states all schools should require children and staff in schools K-12 to wear face coverings consistently when indoors. Just looking at recent and ongoing statistic and metrics clearly call for this board to approve an immediate mandate. In brief, a cluster of cases was confirmed last week at North Henderson High. 55 new cases in the district were reported today, with 4 schools reporting sufficient numbers to qualify as a cluster. There is a neighboring county comparator in Polk County, which schools do have a mandate and, not surprisingly, has lower transmission and confirmed case statistics than Henderson County does. Polk County, of course, follows the Strong Schools North Carolina guidelines. In closing, a mask mandate is a proven, effective, and simple step that will greatly aid in the protection of our children and community. And the comment about whether or not kids can wear it effectively is just a matter of routine, as I saw personally in the charter school. Thank you.
Thank you. Next up is Ms. Courtney McCall. Welcome, Ms. McCall.
Amazed I'm still standing and breathing. Last week was one of the best weeks we have had all school year. My students came in excited to be back from break. Some were in masks, most were not. They laughed, they smiled, they worked together, and it was normal. Stop using our kids in this political, and yes, it's political, game. They should not be blamed for adults being in the hospital. The 2 cases, that I've had in my class got it from a parent at home, not the other way around. Stop bowing down to people who are too afraid to get on with their lives. Like you said, it's here to stay. There's always going to be a variant to deal with. And you should be more worried about driving teachers away who aren't afraid to come in to teach and be with these students. Value what your teachers are telling you. Stop moving the goalpost. You wanted teachers vaccinated, it's done. You wanted 12 and up vaccinated, it's done. You wanted 5 and up vaccinated, it's done. We wanted 2 weeks to slow the spread, and we're going on 2 years. Stop making masks be the end-all be-all of this pandemic. Might I remind you that even mainstream media has finally admitted that cloth masks don't work, and that 99% of our kids are wearing not only cloth masks, but cloth masks that are filthy, not washed on a regular basis, although they do make great slingshots and snack holders. Masks don't cut quarantine for a lot of us. My kids eat in our room. We eat snack in our room. We do lessons, phonics lessons in elementary school in our room. So it doesn't matter if every single kid in my class is masked, they're still going home for quarantine because we eat lunch in our room. It doesn't change a thing for us. If you want to burn even more bridges with your community, go ahead and light the match. But we still don't co-parent with the government, and that includes the school board.
Next up will be Ms. Katie Gash. Welcome, Ms. Gash.
Good afternoon. And I just first want to just thank our medical professionals for taking the time to be here and for giving such a concise overall view of how things are going on here. I've written, as board knows, to you a couple times, so I just wanted to kind of piece together a few of the things that I have sent in earlier, mainly because I haven't heard from some people, and that's okay, because I know you guys have a lot going on, but I just wanted to make sure that you heard me. So, dear colleagues, and this was written December the 21st. So, dear colleagues, as I sit here and watch our local WLOS news, I feel compelled to reach out. Hospitals are beginning to fill up again. Residents are becoming sick and being placed on ventilators. Our COVID numbers are rising in a way we might not have fully anticipated. Doctors and nurses are working around the clock, as they told us, putting their own health at risk, and emergency room and ICU staffs are saddened and overwhelmed by our community's lack of precautionary practices. Indeed, our health officials are asking us, they're pleading with us to take all precautions to protect ourselves and our vulnerable neighbors. They urge us to wear masks in crowded indoor spaces and to fight against personal complacency. So with this in mind, I want to ask that we, as a school system with 13,000 students plus, and being the largest employer in our county, let us play our part to support our healthcare workers and to model responsible, selfless, and wise health precautions for the community to see and to follow. I understand a lot of people aren't doing what they should do, but that does not excuse us. We should still be the leaders where this is concerned. And yes, I feel like the burden is on us, but if it's on us, and let's do this. It must be a team effort. It will take a village, and we must all be rowing in the same direction. Yes, personal choice, remask, is an ideal that we all embrace, but might I suggest that much more important than personal choice, especially at this particular juncture, is our personal and collective obligation to our society and to that which is bigger than our individual preference. We need to support our caregivers, our first responders, our healthcare leaders, and if this means masking up, educating people about the option of vaccinations, and being an example for our society to follow, then let's do it. I'm in. Masks have proven to be a very effective way to enable in-person learning while reducing the risk of spreading this illness that we're all so tired of dealing with. If we make mask requirements versus no mask requirements as the two options before us, then we surely all agree, as the data bears witness to, that the former helps more than the latter to ensure that we have our students in the classrooms and enough teachers and staff to keep our buildings safely open and operational. I appreciate each and every one of you. Thank you.
Thank you. I believe it's Blake Honeycutt, I believe. Did I get your last name correct? Yes, sir. Perfect. Welcome, sir.
Thank you. I'd like to say thank you to the board members, especially the ones that are sitting here wearing a mask and not on their cell phone, such as Chairman Craven and Chairperson Holt. I'm asking you today that when you vote on the mask, I would like for when you say your yays or your nays, I would like for you to explain why you have a yay or a nay. I just want to know how you guys feel about the situation. I yield my time.
Thank you. Next up, last on the list is going to be Tay Brown. Welcome, Mr. Brown.
Hello. So the battleground I'm speaking about is specific to Henderson County, just like our physicians were speaking to and referring to a little bit earlier. Not that educated to take on the global issue yet. And like we've discussed so much before, there's so many voices to calculate in the situation. And personally, I believe there's one specific voice also on the front lines that I believe is going to help us determine how to best move forward and keep our kids in school. And I just want to echo that voice. I'm here today with you all. But before I begin, I'd like to personally just take a couple seconds to recognize all those that we have lost to COVID within our community and our school systems. Thank you. Also, thank you for hearing me out today. Thank you for your service and your time. Most importantly, thank you, God, for the breath you gave me to wake up this morning. The goal of this message is to encourage you all to create or amend existing channels to fairly, pragmatically, and holistically incorporate teacher voice into policy-making decisions for our school system, both here at the Board of Education and at the central office. This message also serves as a gentle reminder to where it began for all of us, in the classroom, with our teachers, and to never forget that. I believe that by placing an emphasis on galvanizing the teacher voice and incorporating it, then we are even more prepared to nurture our students, our staff, our teachers, and our school system. Although we are in the midst of a global pandemic, I believe we must nurture the foundation of our school system, the teachers. By doing so, we have the ability to set the precedent for the rest of North Carolina, like we always have, with a strong and secure foundation. And some, like Mother Maya Angelou once said, you may not control all the events that happen to you, but you can decide not to be reduced by them. We cannot control corona, but we surely can decide not to be reduced by them. Although this is my last week as a teacher with Henderson County Public Schools, I know and believe in the power, insight, and care that our teachers give. I would not be the man I am today standing in front of you as a first-generation college student from the University of North Carolina Chapel Hill without my teachers. I've watched teachers tie shoes, Germ-X, booger-infested fingers, and provide students a space to share the many things that plague their lives outside of school. Our teachers are the crux to our school system. It's like Malala once said, one child, one teacher, one book, one pen can change the world. I ask you all to take a pause for a couple seconds and reflect on all the great teachers that positively contributed to your well-being and successful futures. Also importantly, I'm never going to forget where I came from. Thank you, Henderson County Public Schools, and thank you, Henderson County. I sure as hell won't forget teaching for the first time during a global pandemic. Shout out to all of our workers, staff, teachers, and everyone alike. Teaching truly is a calling. So just a gentle reminder to you in front of me, the ones who hold the influence, power, and ability to create or amend existing channels, both here and at the Board of Education. Our teachers are people who have the superpowers that will not only bring us through this unprecedented time in the world, but allow us to thrive. Like Nelson Mandela once said, education is the most powerful weapon which we can use to change the world. Let's continue to lead in education, starting with our teachers. Thank you, and go Knights.
All right, that's the end of our public comments today. I am now going to, before we get to the consent agenda, I want to go ahead and get the current face covering guidance and policy knocked out. So if you're ready, Dr. Bryant, let's go.
Yes, sir. Thank you, Mr. Chairman and members of the board. I will work through the slide deck, working hard not to belabor some of the data that you heard during our program highlights. So please stop me if there are clarifications that are necessary or specific areas in which you'd like to discuss a little bit further. In short, the starting point has always been a graphic representation of our Harvard Global Health Institute and looking at those daily cases per populations of 100,000. What you can see here is a shift from the data that we saw represented in December up until recently, coming back from the holiday in that January 3rd number is 114. Current data as of yesterday is 102.7. And so I would share and just echo at this time, while it is considerably higher than the most recent surge in August and September, it's the highest data set that we've seen since we've been tracking this since the start. Just for perspective, again, you can see this is the historical data all the way back to March and April of 2020, and what you're seeing is the slope of that line in January 22, dramatically impacting the scale of what we're dealing with in not just our community, as we see in Henderson County, but across the state and across the country. We, of course, have also utilized the DHHS County Alert System report that relates to what kind of transmission you're seeing within your community and what those levels are. Here is a data slide that just shows what is taking place within a 7-day period in our community right now. That data, again, is current as of January the 9th. You're looking at case rate, positivity rate, again, the population greater than 5 years old that are considered vaccinated. When you look at this particular slide, it's one that we've seen before. At a time in October and November, we remember that we saw substantial or moderate impact across this data set. The entire state of North Carolina is considered a high transmission area at this time. When we talk about our district dashboard, this board is familiar, as is the public, that we continue to publish our data as it relates to positive school-affected cases, and then we publish weekly information. Our most recent communications, as have been mentioned by this board, are number one, we had to make a decision yesterday to move Flat Rock Middle School to virtual learning only, specifically as it related to staffing shortages in that environment. At the time of this meeting right now, we have over 19 staff members that are unable to report to work because they're positive, they've been quarantined, or they're awaiting a specific test result. Additionally, we had to make the determination just prior to the start of this board meeting that Apple Valley Middle School would move to a virtual learning environment for at least 2 days, again, based on staffing shortages associated with that. I think that again, is representative of some of the conversation you heard at the program highlight, and from a school system and an operational standpoint of paramount concern, because our prioritization has been the stable face-to-face instruction and instruction opportunities for that. When we talk about school-affected cases, we'd remind the board that we do not do at this time the daily alert notifications and have not done so since October. Folks can view the district dashboard each business day. And again, district cluster notifications continue as required by law. I want to answer questions specifically related to that third bullet because it does come up based on the number of cases that we're dealing with right now. Simply having 5 cases as a school doesn't merit a cluster. They have to be 5 cases that are somehow determined to be linked in some way. So when folks look at the dashboard, sometimes they say, well, I saw 5 cases at this particular, why didn't we get a cluster notification? Those 5 cases could be 1 student in 5 different grade levels. And so when we look at those situations, they have to be linked in some way in order to be determined to be a cluster. Our communication graphic, again, is one that this board is familiar with as it relates to our operations and the communications that we're making. Specific to the discussion that has been taking place as it relates to the program highlight and ultimately what is required by this board currently and as of January the 1st, based on the December decision of this board, face coverings are optional for all students, all teachers, all staff, all adult visitors, for anyone in our school facilities and all school settings and properties. The only place that there's an exception to that right now is when students are in a group transportation setting. That requirement still exists for us. Remind this board and again the public, we are required to vote on this at least once a month, every single time. Conditions certainly change, but regardless of those conditions, the board has to make a determination as to whether to change our current policy or to remain with the policy as it stands right now. Now, there are a series of slides that follow this one that do deal with test to stay and deal with some of the other things that are present as it relates to that. We can pause here. Again, I don't want to belabor what you've heard from people who are far more gifted when it comes to understanding the way in which that impact is affecting us from a medical standpoint, from a healthcare standpoint. Allow the board to deliberate and ask her any questions related to our operations.
Yeah, I've got questions. We just put 2 schools on virtual.
Yes, sir.
So over 1,500 students. We've got 2 other schools that are very, very close.
Yes, sir.
How close are we to going virtual overall in our school system?
I wish I could answer that question, but if we continue in the direction we're going, we're going to be there very quickly. As you heard in this previous discussion, and I will emphasize in no uncertain terms, what we have prioritized in this school system is stable, safe, face-to-face instruction. That is in jeopardy right now, and it's in jeopardy based on our operations, and it is illustrated by the fact that 2 of our environments are already there. Every individual who is able to go to work and stay at work allows us to stabilize that. In the same way that every student that is able to attend school safely every day has greater access and opportunity. The trend data that we're seeing right now puts us at risk, and you referenced other school environments. We have 2 that will be in a virtual learning mode for at least 2 days this week, and we will be monitoring all 21 other environments as we move through that.
Prior to coming into this meeting, I just saw that Blue Ridge Community College has mandated masks for all of their staff, student,
Yes, sir.
and visitors beginning tomorrow. Is that correct?
Yes, sir, I'm aware of
And
that.
will that affect our IHS students that are at the Innovative High School since they're on that campus?
It will affect them. So the way we've generally operated is board policy adheres to what takes place within the school building that is IHS. When those students leave that school building, they follow Blue Ridge Community College policy. And so if this board were to make a decision that's consistent with the board at Blue Ridge Community College, then the application would be the same. But if it were not, any of our students who are articulating on that campus would be required to follow that rule.
I think, the thing before us is mask or no mask, right? And the validity of them and is a cloth mask even stopping anything? And from what I'm hearing is that even if we can stop it by 1% or slow it down by 1%, it would help out our community at large. At this particular time, being that we have 2 schools that are all virtual, we've got several more that are right on the door. You got Blue Ridge that's gone to masks. What is your recommendation for this board for this particular meeting?
Absolutely. Before I speak to that, I would like to make one note about face coverings because I've heard the question get asked several times already today. We are equipped and have in stock the ability to provide procedural masks, the kind like I'm wearing right now, to every student, every staff member who would like them, right? Should the board make a decision or not make a decision, when people are requesting that, we have been providing specific personal protective equipment to staff members who have asked for specific elements. But when that question was posed earlier about whether or not a cloth face covering would be as effective or not, for those that want a more effective face covering, then that's something that is available and can be provided to everyone.
Okay, thank you.
Yes, sir. Yeah.
We've also had several parents who have written to me and said, we would send in boxes of surgical masks for the class. I don't think that there would be a shortage of surgical masks.
Right, and that's not necessary. I certainly can give credit to our
right.
Chief Administrative Officer and our Director of School Safety in terms of our obligation to be prepared, even as these times ebb and flow as we work in this. I think that is something that's responsible to us. Again, should people want access to a procedural face covering, then we have the ability to provide that to them.
Are the schools still pursuing social distancing and also the hand washing?
The hand washing, certainly. The social distancing is far less so in our current environment. Certainly there are places where students choose to do that themselves, or in some environments where they can do it. But you would see plenty of environments where the social distancing is minimized in our current operations. Yeah.
To get these new masks, do we have principals call you, parents call you, teachers how do we get these for the kids?
So specifically, we have them available at every school
Okay.
site, so they can be provided the minute you walk in the door. If the student wanted to utilize them, a visitor wants to utilize them, or otherwise. We have PPE quartermasters, Ms. Case, as we have throughout this whole process at every school site, and so we're providing the specific request as they're made. Yes, ma'am.
How many at Apple Valley, how many tested positive?
How many, how do you mean?
Positive.
In terms of the
Staff.
numbers that were made for
Teacher
the
staff.
determination? Yes, sir, just 1 second. So right now, of the group that it's Apple Valley right now, we have 3 who are positives, 2 who are awaiting test results, 2 who are simply sick, 1 that is an unrelated injury, and 8 who are under quarantine.
And what about Flat Rock?
7 COVID positive, 5 who are under quarantine, and 7 who are sick and awaiting a test result.
May I ask a question?
Yes, ma'am.
Just for clarification and make sure I'm thinking about this correctly. Am I correct in thinking that this time last year in January, our transmission and positivity rate was not as high as we're currently seeing, and we were virtual? Is that a correct statement?
That is correct. It has never been as high as it is right now. Yes, ma'am. That's correct. And at the request of just having the full context, and then I'll fulfill your question. Specifically looking at what this week is, Friday, January 7th, is the highest positive rate we've had on any single day related to that when you look at the number of students that are positive and the resulting quarantines associated with that. So specifically, I'm sorry, yes?
No, go ahead.
I was going to say, so specifically, in answer to your question, when you ask, what is the recommendation of the school administration, and specifically me, the superintendent, if we continue to operate masks optional, we are running the great risk of not staying open for very long at all. And that risk may be there anyways. It is my recommendation that we move to a fully masked environment for everyone at all times, for all instructional days, while we see this work through. When we think about our obligation to our students, to their families, to our healthcare community, to our workforce, to the economy, and to our ability to have a safe place for students to be present, the one thing that keeps us in that space is to do all things that we can do. And I do believe, because we talk about it a lot, even 1% difference matters. I'm not saying that will be popular. I'm not saying that people will like it, and I can accept that part of it. What we have a responsibility to do is to be part of taking care of each other. And again, the way in which we do that is to recognize that we keep school open for as long as it can be, because for every staff member that we keep at work, for every bus driver that can drive, for every teacher that can show up, we have a greater opportunity of serving our students. I know that this week has been joyous for students and families, and certainly for our staff. I don't know a single person that wants to wear a face covering forever and ever, amen. In fact, I want to acknowledge I don't like wearing one either. I've said it repeatedly, but I will wear a kilt, as I heard one of our PE teachers say. One of our PE teachers said, I'll wear a kilt if that will keep kids in school. And I want to affirm the same thing in that space. So if that's the opportunity that we have present for us, my recommendation, as clear as it can be, is that we have the ability to support every space to the best of our ability by making that a requirement while we move through this. And it will be my great hope, as I'm sure it would be for this board, based on what you would decide, that when we return together in February, that we can make decisions that allow us to move back from that.
John, what are you recommending about sports with masking? Sports.
In terms of voluntary activities right now, nothing. What we're looking at right now is the school day itself. There are lots of things, and the question was posed, are there exposure opportunities away from school? Absolutely, right? When we talk about where we create guardrails, school is a requirement. It's compulsory in that respect. Choosing to be present for an athletic activity or otherwise, we know that those things are the case, but I'm not making a recommendation in that space right now.
It's clearly these numbers that you're seeing here, this was from last week, are a byproduct of not being in school since we were not in school.
Correct.
That's correct.
You know, what we'll see this week could potentially be a byproduct of what was in school or not. We have really no clue. But what we do know is 115 are positive as of last week, and then 82 quarantines so far.
So can you go back to the slide where you were showing the data trend with the big jump?
Yes, ma'am, absolutely.
That was the question that I was going to ask you before.
This one?
That one. And it's as of December 27th. So for me, looking at this, we were out of school 10 days at this point when the data went from all the way down to all the way up. And what hospitals are seeing now is a result of community spread, has zero to do with our schools. Something else that rang really true to me was when I asked about the people in ICU, because we're not saying everybody isn't, I'm just going to say it. We need to get herd immunity to get through this. I know it's not popular. I know people don't want to hear that. I know people don't want to get COVID. But we have to get herd immunity to get through on the other side of this pandemic. And it's the hospitalist said there's no one in their ICU that is vaccinated. There's no one on a ventilator that is vaccinated. We're not promised we're not going to get sick. We're not going to be home for a week. I had COVID on December 20th. And like someone wants to think that it's their business to know why I am or am not wearing a mask, I'm 21 days out and I'm not carrying COVID. The health officials say once you get 14 days out. So further from that, these are adults that have made a decision that are in these ICUs that are not vaccinated. Why should our children, our staff, carry the torch for people that are going in the hospital and going on ventilators because their parents don't want their kids to wear a mask or our staff members don't want to wear a mask? I just feel like this is a personal liberty that and I hear these people and I don't want to go to virtual. I hear exactly what you're saying. I don't want our schools to go to virtual. As a parent, would I choose my kid to be masked or virtual? I would choose my kid to be masked. But that's me making a decision about my about my child, not me making a decision for another parent. I mean, when ages 5 to 11, 16%, I said in November it's not going to be higher than 20. I'm surprised it's as low as 16%. These are the decisions that these parents have made for their kids. When I walked through a school visit last week, I counted in every classroom we were in, I think we were in like 11 or 12 classrooms, 5 kids wearing masks in the classroom, 20, 25 kids not wearing masks. There was one classroom I counted 10 masks in. Teachers, the majority of the teachers didn't have masks on. These are people making decisions for themselves as a staff member to be vaccinated or not. and making a decision for their children as an adult, what they want for their children to be masked or not masked. I don't see the point in us continuing this and not getting through this pandemic. Nobody was sick that much in, like we're talking about last January or the whole school year last year because there were masks on. We still have COVID around because we don't have herd immunity. The vaccines clearly aren't providing that. And the new data is out is, okay, go ahead and get boosted. Oh, by the way, that booster only lasts you 2 months and then it's 30% effective. People have to make these decisions for themselves, whether they're going to be vaccinated and boosted and wear a mask and not. And I'm just not willing to take that right away from parents and staff members.
And I'm sitting there. Go ahead.
Thank you, Mr. Egoff. Just one clarifying point about this, because I appreciate you bringing me back to this slide. Just as a frame of reference, when the board gives this consideration, we've heard from our healthcare leadership, and we also understand from what we know that the peak of this data may not be until the end of this month or the 1st of February, ideally sooner than that. The peak in the areas across the country, when you look at this comparable, is 4 times this number. So when we talk about what we're dealing with, this is the highest we've ever seen it in our community. And the peak of this over the next couple of weeks could be 2, 3, 4 times greater this in terms of the context of what we've heard. And so that idea of when I talk about 1% difference, 5% difference, 10% difference in terms of workforce stability and stable learning environments is not just looking at this like that 103 means we're on our slide down. It means that these numbers could reach 200, 300, 400, and recognizing what that means to us in terms of the choices that we
But when you talk about workforce stability and kids in school, that is most affected by quarantines. I did the math, 0.0088% tested positive. Who are we kidding if we say you've got to wear masks in school, but it's okay to leave school and take your mask off throughout the county? For the county commissioners, it's okay. Oh, and it's okay to go play sports and play with all these people without masks. When you have 5 to 11, 16%, Mr. Craven said, you know, when people have the vaccine, when they're eligible for the vaccine, they need to take it, they need to make a choice. Well, you know what? It's out there. They can choose. That's a beautiful thing. Everybody gets a choice. 16%. That number may go up a little, may go down a little bit, but it's not going to go to 80%. People have made their choice. 37%, 12 to 17. This is not going away ever. Just like Ms. Holt said, this is not going to go away. We're going to have this. We're going to have different strains, different variants. We can't always go back and say, let's put on the masks. I'm sitting here, I'm teaching, no, I'm not, but I'm helping. Third grade, second grade at Clear Creek. I can see what it's doing to kids.
Yes.
It's not good. And we can't keep saying, there's something going on. We need to put a mask on. It's like we're reacting instead of doing something proactively. Like, again, finding out how many of these 382 people can stay in school rather than have to go home.
And I would just remind the board, I appreciate that note there when you look at the numbers. When we were in a fully masked environment, our quarantine to positive was less than 1 to 1.
Correct.
It was less than 1 to 1. In fact, we were at 1 to 0.5 when the requirement existed because of the number of people that were not able to attend school. So yes, we knew a condition of masks optional was going to exponentially increase the number of quarantines, heard loud and clear. When everyone was wearing a face covering, yes, people tested positive, but oftentimes that only resulted in 1 other quarantined rather than 5 or 10 or 11 in those situations. And in a condition where the number of positives has increased exponentially just by the sheer math, there are going to be more quarantines if we don't take proactive steps. And I would argue that a face covering in this current condition right now is a proactive step.
Even though you don't have to wear one after school, and you don't have to wear one if you're playing basketball.
I don't think we can control what people are doing outside of the school, but why add to it? That's like saying if somebody's breaking the law outside of school, let's let them break the law inside of school too. I mean, Ms. Holt asked why we need to carry the torch. Well, I mean, you know, if not us, then who? I mean, I think JFK said that. You know, we've suffered several tragedies over this weekend that we all know about because of COVID. I think in-person is in absolute jeopardy if we are not being proactive by wearing masks. And I think the one thing that we should be voting on is not whether we want masks or not masks. We need to be voting on whether we want masks or virtual, because that's really what this comes down to. So for the gentleman that asked why I would be voting yes, that's my answer. I mean,
Because of our quarantine policies. That's what
no,
needs to change.
No, it's not quarantines. We're seeing
Yes, it is.
cases.
That's
No,
why the
cases.
people aren't working. That's why the students aren't there. 382 quarantine.
Quarantines quadruple when we are mask optional, Jay. That's the data. The quarantines will triple and quadruple, and that's the procedures, that's the process, that's what we're living in. My whole thing is, number one, I want to keep our schools open and keep children in school. This thing is going to ebb and flow. Jay, I do agree with you. It's going to be here. If it's going to be this strain or that strain, that's why I wish we as a board could come to some kind of agreement like some school boards have come to. I think McDowell County, and I think you shared with me Rutherford County, and they have said when the community transmission rate gets at a certain level, we're going to be mask required. When it moves down, we can go mask optional. And that way, we are basing our decisions on a community transmission rate. Now, I'm not saying that that's the end-all and be-all, and that's the all, but at least we have to understand this thing is going to ebb and flow. And if we could agree on when it goes to high or substantial, that we're going to mask up until that comes down. And then I think what that shows is, a lot of people say we flip-flop. Yeah, we're gonna have to change our minds because things are changing. This thing is constantly changing. And if we don't step up and be leaders and pivot when the circumstances change, we're not leaders, in my opinion.
We've got to do what we have to do to look after the safety of all our students.
Yes.
If that's wearing masks, that's wearing masks. If that's optional masks, that's optional masks. I don't like them either. But if we can do a little bit to help, and we don't know if it's going to help or hurt, but if we got to be proactive and look after the safety of all these 13,000 students.
I think we all
Maybe
can agree
for a
we don't
month.
want to go virtual.
You know, maybe in 4 weeks, 5 weeks, 6 weeks, this thing will decrease. But right now, we have to look out for the safety and welfare of our 13,000 students in Henderson County.
Thank you, Rob.
I would like to take us back to March 13th, 2020. And we shut down schools altogether. And then we spent the next 8 months trying to figure out how to get kids back in school. And that was our only concern, was how to get them out of virtual. We didn't know what this thing was. We had no mitigation strategies at that particular point. And we were just trying to get kids in school. I was at home with a kindergartner and trying to run my practice, my business, under impossible circumstances with 3 kids, doing virtual. And I don't want to wear the mask or make the burden on any parent to have their kid have to wear the mask any more than anybody else in this room. But I think when it comes down to brass tacks, we have 2 schools that are virtual right now. We have 1,500 kids at home right now, today. Tomorrow, that could go ahead and add another 1,500 with Atkinson, potentially rugby, and potentially some others. And I just don't know how I can justify, even though that I don't want a mask, and I want it to be the parent's choice. How can I justify leaving those kids at home? Because I know what that's going to do to me and my family when all of a sudden we get the call at Harrisonville Elementary or IHS, and I've got to change everything what I'm doing. And then another thought that I have is that Dr. Herbert's was my kid's pediatrician for years and years and years. And we went to her for pertussis and for the strep and for flu and for every other thing that my kids caught at daycare or whatever else and brought home. And I took her advice and said, you know, this is how we get our kids, you know, better. How can I then dismiss what she's saying to me and to us and other community members that if I were to get sick or my family were to get sick that I'd be running to help me? I have a hard time with that. This has not been easy on me. Hasn't been easy on my family. Hasn't been easy on you. And I don't see it getting much easier now or anytime soon.
And when we go virtual, I think that impacts the children, their learning and their social-emotional state, but it also can be economically devastating to families.
Absolutely.
Absolutely.
You know, absolutely. And so,
I mean, when you think about that we have 1,500 kids at home right now, you know, some of them may be 2 kids per family. Most of them probably are not. But you think about parents that they can't, their kids have quarantined already twice this year. They can't miss another day or they're going to miss their job. Like, that's where I want to go around and staple masks on. Like, that's where,
Exactly.
you know, I don't want kids missing school. I don't want there to be impact of, you know, the financial impact of parents losing jobs or not being able to go in or it being a burden to whatever it is, whether it's the hospital or the police department or, you know, whatever. I do have an issue with that.
before August of this year, that wasn't ever the mask wasn't the topic. It was keeping them in school.
Right.
Exactly.
And we're not doing that now. We're not. And that's the crux of everything. Kids are not in school tomorrow. That should be, right? That we know need to be in school, need their teachers. And I don't want to, as much as I don't want to mandate masks, as much as Amy and Jay, I don't want to do it. I don't. But I just don't know how I tell the people that are going to take care of us when we get sick. And those parents that are taking care of those kids that are home tomorrow, so what? Tough luck. I don't know how to do it. I don't.
I think sometimes being a leader is making a decision that you might not necessarily want to make. And I know how you guys feel. There's no doubt about it. I just think we have to look at the whole picture, and kids being home from school is not where we need to be.
And I agree. I don't, learning from home sucks. That's not a word that you're supposed to use in school, but I just
Say you were working with third graders?
Sorry.
Word of the day.
But I know it is not good. Is that better?
Yes, sir. Thank you, sir.
Sorry.
We have high expectations here.
No,
Okay.
us parents will say it sucks.
But are we doing, and I keep going back to this, and we're going to discuss this later, and that's fine. But I keep looking at this, and I look at the people that are quarantined, and I look at the sheer number, and I understand. Yes, you have to shut down school, but I'm looking at 3 from Apple Valley, not 3 and 2 and 2 and 1 and 8. I'm looking at 3. I'm looking at 7, not 7 and 7 and 5. And I understand all that put together, yes. But are we doing enough to try to keep people in school?
Yes,
Or are we just looking for ways that they should go home?
well, we're certainly not looking for ways to send people home.
But that's all I hear about is you're testing, you're quarantined. Oh, you were sitting beside him, you're gone. You're gone. You're gone. Let's say, you know what?
I think what you heard earlier, and I can only again echo the exact same sentiment. When you listen to the number of absences, we have people that are out for all manner of reasons, right? Pre-COVID, right? Take COVID out of the equation. People miss work for a lot of reasons. When you add COVID on top of it, which we can't ignore and we can't pretend exists, everybody who's an employer understands that it works this way, that there are impacts associated with that. Additionally, in this situation, we have implemented a number of strategies that try to minimize that. One of them, again, when we just speak to quarantines being like that thorn in our side that sort of says, is this someone that really doesn't need to be at work, or doesn't need to be at school? There are strategies that have helped to reduce that, and we've even seen the guidance get revised in that space. Even most recently, the toolkit saying you could have participated in this test to stay study, but you can also implement a similar condition yourselves if and when you have the resources, the logistics, and the supplies to do so. But I want to speak very candidly with this board. There are not a whole group of people right now in the current conditions available to implement a whole nother layer of let's test everybody from a screening and a diagnostic strategy. Even as we've evaluated that within our own school system under this current surge, that likely could not be implemented with any capacity until at least at the very earliest February, because of what it takes to do that. But I hear you loud and clear, because it gives us opportunities to move forward as we move through this space.
I mean, I hear people going to get tests and testing negative, but that doesn't matter.
Well, I can't speak to an individual situation. What I can tell you is there is clarity about what test is that from, and specifically who provided. Is it a PCR? Is it a rapid? Is it an antigen?
I understand, but these are just broad strokes.
I understand.
I hear email after email after email and conversation after conversation, and all these people saying, my kid keeps getting tested negative, but I got to keep him out for 10 days. This is before the 5-day rule. And now I got to keep out 5 days. And I'm
Yes,
like,
sir. And what I would go back to is when case counts are up, as they are right now, face coverings on everybody every day reduced our quarantines to less than 1-to-1. Less than 1-to-1. So I hear you. I understand.
that's because we said the rules were if you had a mask and you had a mask, only that one person was taken out.
And those are the rules.
But we're not, but if you wear a mask,
Those are the rules.
that's right. That's what I'm saying. That's why it was 1-to-1. But this guy that's sitting beside me wears a mask. He may be positive and not testing, but we don't test him because this one has a mask, this one has a mask, and I test positive. Well, I'm the only one gone. We're not even trying this guy now because of the mask. That's not saying he's not positive. We're just not testing. We don't care.
What I'm articulating is the desire to keep everybody in school every day, every staff member in school every day, and the stabilization of our workforce. I understand there are lots of elements that are imperfect, and there are lots of elements that are frustrating. What our commitment has been is how do we make sure that students have access to face-to-face instruction? We have set that as our guiding star the whole time. And Ms. Holt, I appreciate what you said. If I have to choose between a face covering and a computer at home for 3 days or 5 days or 3 weeks, I'm going to choose a face covering every time in that same space. And so what I'm asking the board to consider is not the perfection of the situation that we're in, but the reality of the situation that we're in. And I feel like that's why that discussion, and certainly understanding the context of our community and the impact in our community, is critically important.
I'm done, sir.
Are we going to do the test to stay study
Yeah, I
at
mean,
another time,
you
or?
know, we can go through the test to stay study after, or we can go through it now if you'd like.
I mean, whatever. It doesn't matter. I just want to make sure we don't skip
I'd like
that.
to go, we're not going to skip that. That's, the test to stay is not going to be able to even feasible until February 1st.
Right.
At the earliest.
And we want to be able to, I think right now, like we were talking about, is that we have 2 schools that are out. We have potentially several more that are razor thin based on the quarantine guidelines that are given to us from other agencies that we are not in charge of, that we may or may not agree with. but it's the game that we have in front of us, right? And so if the answer is mask, to try to reduce that amount of quarantining, so we can keep our staff in place so we can have school open, or don't do it, and then all of a sudden we're virtual all across 23 schools with 13,000 kids. I think it's, if you go back to pre-August, before this mask mandate really got crazy, we wouldn't even be thinking about this. We wouldn't even think about this twice. Nobody in 2020 would have thought twice about it. If I could wear a mask and get these kids off of computer or not A day or B day or C day or E day or whatever it is, we'd be on it in a second.
Mr. Craven, would you entertain a motion?
I would, yes, sir.
I'd like to make the motion that we continue mandating masks through this month for faculty, staff, and students.
What about visitors?
And visitors, yes, sir.
I second.
Before we go any further, Dr. Bryan, is that the motion that you were wishing that this board would make as it relates to in-school services?
So just to clarify, that would be a face covering requirement for all individuals, staff, students, visitors, and the like during the instructional day at all school sites and all school locations?
Yes, sir.
Yes, sir.
That's what you like, Dr. Bryan? Is that what you're asking for from this board?
Yes, sir.
I have a second. Is there any other discussion on this?
What about phonics?
This board previously made an exception for direct phonics instruction. I think we've recognized the value of that and the ability to be able to utilize that in small situations. I think that exception would be applicable again. Yes, sir.
Use that as administrative discretion? Is that a question or just a statement?
I was wondering if I just heard face masks all day long instructional, and I was just clarifying that was not to be, it was okay to take them off for phonics.
This board previously made that exception.
Okay.
And,
Yes, sir.
and we did have questions from, I want to say there were 2 speech pathologists that had emailed in and said, why during phonics can they have it off? What about when my kids are working with me? I know we had some discussion about that, and that's what was intended, but I just want to clarify that during speech.
For direct oral instruction or direct
Okay.
phonics instruction
Okay.
across the
I
board.
mean, I know some are not going to be comfortable with it.
Yes, ma'am, but again, that option existed, so per Mr. Egoff's question, not every teacher took advantage of that, but they had the ability to apply the exception for direct phonics instruction. Yes, ma'am.
Any further comment, question, concern?
Yeah, I know you're going to call to a vote, and while I would like for schools to not go virtual, I just cannot support taking away the civil liberties of our parents and our staff. I can't do it.
Gotcha. I think we tend to do that sometimes when we have to take a school virtual, because not all those kids ask for that too. You know, it's just a different way of thinking about it. So I'm going to ask for a vote if no one else has any other questions. All right. Mr. Bridges, yes or no?
Yes.
Ms. Case, yes or no?
Yes, for the mandate.
Mrs. Holt, yes or no?
No.
Mr. Egoff, yes or no?
No.
Mrs. Caskey, yes or no?
Yes.
Dr. Revis, yes or no?
Yes.
And I'm a yes. That motion passes 5-2. All right. I'm going to call for a 10-minute break.
Mr. Craven, can
Yes,
I
sir.
ask for a clarification? Just
Sure.
on that, based on that decision, we are prepared to provide that notification if necessary because
For
we have.
tomorrow morning.
Yes, sir.
Yes, sir.
Be effective tomorrow? Effective tomorrow? Absolutely. Okay, so we move forward at this time. Thank you.
And I'd like to call a 10-minute break, please. Yes, sir. All right. Thank you, everybody, for allowing us to take that quick break. We're going to get on with the rest of our agenda today. First up is going to be the consent agenda. We have two resolutions that we're going to pull out. First is going to be African American History Month, and the next is going to be School Board Appreciation Month, which I'm not sure there's much of that right now, but I would just like to go ahead and I'll take a motion to approve the consent agenda before we read those resolutions.
I move we approve the consent agenda as presented.
Second.
All those in favor say aye. Aye.
Aye.
Any opposed? Good. Ms. Holt, African American History Month resolution.
Resolution honoring the observance of African American History Month, February 2022. Whereas since 1976, the month of February has been designated as African American History Month, and whereas this designation was made through the efforts of Dr. Carter G. Woodson, who in 1926 began the observance of the second week in February as African American History Week in honor of the birthdays of Frederick Douglass and Abraham Lincoln, two individuals whom he felt had dramatically affected the lives of African Americans. And whereas it is a time for all Americans to reflect on the history and teaching of African Americans whose legacy of courage and dedication has helped guide our nation's success and prosperity. And whereas we recognize that our society's rich diversity is one of our greatest strengths and unite around the fundamental values that we share as Americans, and whereas our children must realize that America's story has been written by men and women of every race and creed and ethnic background, and whereas we can assure that our laws, our actions, and our words honor the rights and dignity of every human being. Now therefore be it resolved by the Henderson County Board of Public Education that the month of February be observed by the Henderson County Public Schools as African American History Month, adopted this 10th day of January 2022.
Dr. Bryan, School Board Appreciation Month.
Thank you, sir, and members of the board. This is the resolution honoring the observance of National School Board Recognition, January 22. Let me add, now more than ever, it is certainly that way. And so I'm proud to read this on your behalf. Whereas the month of January is designated as National School Board Recognition Month, and whereas school board members are citizens whose decisions affect our children, what they learn, who will teach them, and what kind of facilities house their classrooms, and whereas school board members exemplify local citizen control and decision-making in education, volunteering hundreds of hours and an immeasurable amount of energy to assure that our schools are providing the best possible education for our community's children, and whereas our school board members represent the Henderson County community, and they take this responsibility seriously by attending meetings and conferences where they broaden their knowledge about education. And whereas with the advice and counsel of the educational professionals they hire, our school board has an impact on virtually every aspect of our schools. Now, therefore, be it resolved by the Henderson County Board of Public Education that the month of January be observed as National School Board Recognition Month, adopted this 10th day of January 2022. Thank you.
Thank you very much. Appreciate that. All right, moving on. Next up, going to be our calendars. We have no old business, so we're moving on to new business. And it's going to be the approval, and really, I don't want to approve it, the traditional calendar.
Me either.
So just to give, if anybody's watching, a little bit of background here, we have three different schedules that we operate off of in Henderson County. One is the early college high school calendar, which follows and mimics Blue Ridge Community College and pretty much every other community college and university in the North Carolina system. Then we have the flexible, which is our year-round schools, with two schools being Henderson Elementary and Bruce Drysdale that follow the year-round schedule. And then we have our traditional, which the other 20 schools follow the traditional schedule. This year, our traditional schedule is 2 weeks, starts 2 weeks later than our regular schedules. We've asked our, just to let everyone here know, Ms. Holt sent a letter or an email to all of our elected officials in the state legislature, along with, and she copied myself and Dr. Bryan on that, to really look at this issue, because what you're about to see is probably the worst case scenario as far as the calendar goes, at least since I've been here.
Agreed.
And we cannot start before the Monday closest to August 26th, which puts us at August 29th start date, which also means that we would not end school until June the 9th, and that's without any inclement weather, which is not ideal at all. Couple things that affects. If your child is on a traditional calendar, and they would like to, say they finished high school early and they could graduate in December and they wanted to move on and go to Blue Ridge Community College, go to UNC, or enroll early somewhere, they can't do it. College is already going to be started that next fall or that next spring. And so I'll let you dig into the weeds of this, but we need help from parents, because this schedule right here is the worst one I've ever seen.
It certainly is the worst-case scenario as it relates to calendar law and the restrictions of it. I do want to give just a quick, brief overview of calendar law.
Please.
You kind of mentioned it. There are a series of factors that are related to that. One of those is the minimum is 185 days or 1,025 hours. We operate on hours. We always like to remind everybody of that. We're not counting days and making up days. We're tracking hours and making sure that all of our calendars have the minimum number of instructional hours, and most of them far exceed. The greatest challenge that we have in instructional hours is actually at the innovative high schools for the early college and the career academy, and that has to do with those schedules and transportation between the two. All the calendars have to include 10 annual leave days. Those are paid vacation days. They're green on all of our calendars. You can see them there. They have to have 11 holidays. Those are the red days. And the one of those holidays must be Veterans Day. I always love bringing this up. Most people don't realize this. The only holiday we have to observe in the calendar for public education is Veterans Day, period. All the other red days could be anywhere we want them. We can place that. We could go to school on Thanksgiving. We could go to school on Christmas, all of the above. I'm not threatening that. I'm just saying that could happen as it relates to that. Total number of teacher work days not to exceed 195. And again, as Mr. Craven said, you cannot start any earlier than the Monday closest to August 26th. So in this particular instance, that closest Monday on our traditional calendar is August the 29th. And then the closing date for students shall be no later than the Friday closest to June 11th. Ironically, in this very same calendar, that means we go all the way to the end of both bookends in this space. So, in order to operate outside of this calendar, we have to be eligible for a waiver, ultimately an inclement weather waiver. We don't qualify. You have to close for 8 days per year in 4 of the last 10. We do not. We don't miss that amount of school for inclement weather and have not done so. We came real close one day, and Mr. Caldwell, our previous superintendent, wanted me to call a snow day on a 70-degree day outside just because that would have got us there. He did go outside. He threw some ice down on the ground, and he said, "I see ice, call off school." That's as close as we've ever been to eligibility for the waiver. So as you look at the calendar, I just touch on a couple of the high points. The constraints of it are those that we have seen, that we are familiar with, and that we recognize. The beginning of our calendar does start the same way and has for the last little bit. We have district professional development days that are designated for all staff to participate. I believe it was Mrs. Case who brought first the teacher protected day to our calendar, the TPD. That's where no staff meetings, faculty meetings, or district professional development can occur. That's a space just for teachers in their classrooms. When you see the little BTs there on August 15, 16, and 17, those are orientation days for beginning teachers, folks who are new to our school system and new to the profession. You see that we've also included district professional development and opportunities at the end of October. Those kind of correspond with the end of the quarter. We get out again on a Friday, preserving 3 weekends for the holiday. I'm going to try to go back up. Can you go up to January? There we go, January for just 1 second. We got a lot of really positive feedback this year about returning to school after the holiday break on a work day. Many of our staff just shared with us they could truly leave it at work. They were able to go home. They were able to be with their families. They were able to take a break. And then returning to our school year, because the semester for our 4x4 schools does continue in those first 2 weeks of January, just like right now. This is a testing week for EOCs. And then you have January 16, 17, corresponding with Martin Luther King as the turnover for the semester. Many folks ask, why do we put 2 days there? 1 day to close the semester, 1 day to open the new semester. And when you think about our 4x4 environments, our traditional high schools, they are ending a school year and starting a school year. February having, again, additional district professional development throughout the calendar. And then in March, you can see the third week in March, as part of a very exhaustive process when we started to explore spring break and look at our calendars under Mr. Caldwell's leadership and our continued discussions, we moved spring break to the same week every year, future forward. I've gotten a couple of questions from people about that. We moved it to the third week in March. It aligns with Blue Ridge Community College. It aligns with many colleges and universities. And what it really does is it gives us an opportunity for parents and families, although it may not be as warm as you want it to be, third week in March, is if you wanted to schedule a trip or you needed to be out of town 5 years from now, you know spring break's going to be the third week in March. And it historically had floated either Easter was the first weekend of the holiday or Easter was the last weekend of the holiday, and so it moved around in some different ways. We did try to preserve the Easter weekend by looking at Good Friday and Easter Monday, and you can see that here. Whoops. You mind sliding that down for me just a little bit so we can look at May and June? It's okay. You did the same thing I did. That's all right.
While he's
See what the
doing
calendar
that, we've
does.
still got exams after we are out for Christmas, and then we've got to have it then, and that's ridiculous.
That's exactly right. So then you have the May designation with Memorial Day holiday and then continuing ourselves to the end of June. And just as Ms. Case mentioned, we have long advocated for the change in the calendar, and we actually got it 1 year. That return from the pandemic was exactly what we've asked for. Yes, sir. We got to start in the middle of August. Semester ended before Christmas. We were done before Memorial Day. It was exactly what this board has been asking for, that we have lobbied. We would love to do that. I would just share with the board, this is a draft, and this is only first reading. So whatever you do tonight, you're not in fact approving it final. What you are saying is, public, this is our calendar, and we want you to see it, and we want you to understand it. And as Mr. Craven said, we are continuing to have dialogue with our legislative leaders, asking for that flexibility because of what a difference it would make. That said, I'll be glad to answer any questions there are about this calendar and then move on to the next two.
How have our staff been involved in this, or how will they be involved?
Yes, ma'am. I actually meet monthly with the Superintendent's Teachers Advisory Council, and those are representatives from each individual school. So they've reviewed the draft calendars. They've shared feedback with us. They've given us some things to think about. They've also brought some things to mind that you may see in secondary revisions as we move forward, because as they've looked at these, along with the Superintendent's Parents Advisory Council, they're able to offer feedback, offer questions, give us things to think about moving forward. And so one example of that was that day that I talked to you about in January, saying, hey, listen, we really loved that work. Like, let's hang on to that work day.
We heard that on the school visit.
Right. Even that day in October, one of the pieces of feedback that we received with that is the ability to have that full day at the end of the quarter. If you remember, we had them, you don't see half days scattered throughout this calendar. They actually only exist in two places in this version: Christmas break and the end of the school year. And there's a reason for that, because part of the feedback that we get is those half days are not meaningful for students. They've not necessarily been meaningful for staff, and certainly they can create challenges and inconvenience for parents. So that's why they're built that way.
How many hours is this calendar?
It depends on the school and the school calendar you're on. So elementary schools tend to have more time that counts toward instructional hours, and so they are oftentimes 70, 80, 90, or 100 hours more than necessary. When you look at our high school environments, they're less so. They're a little bit tighter schedules because you can't count lunch, you can't count transitions, you can't count time that doesn't count toward core instruction periods. So what we do is we monitor that, and we've got ourselves a window. Generally, it's about what I'm going to call 4 days of instruction, or 30 hours roughly in that space, that you could miss school and not have to make any time up. What we do is we pay attention to that based on what happens throughout the school year.
What would happen if we just if we just put it at the 15th?
That was actually,
I mean, what
that's
would
some
happen?
of the feedback that I've received from certain elected officials is just do it and see what happens.
What would happen?
Well, that's a better question for the attorney than I think it is for me.
Well, you know,
Your eyes
prior-
got that big.
What would happen if we broke the law, John? Well,
Let me ask my
Thankfully,
attorney.
Cynthia Lopez is here
Let me ask
today.
my attorney.
So prior to the beginning, to the pandemic, what some people call the before times, several school systems were starting to do that.
Well, yes.
And there was a letter issued from DPI, if you'll recall that, saying you can't do that, you've got to follow the law. And at that point, the legislature seemed to, there was an opportunity there to make a change, and it didn't happen. So the feeling is that DPI, the legislature is not open to it, and DPI will enforce it. Because that's basically what the letter said, which has to do with potentially funding. But it has not been specifically stated. I think the letter that came a couple of years ago did talk about if you fail to follow the law, that it could potentially impact funding.
Could I add one more thing to that?
Yes.
Because this board did talk about this specifically, is many of those school systems are drafting calendars based on what they believe to be a very loose interpretation of the definition of year-round school.
Yes.
And what did happen in that it was the budget passage or the codification of, they defined year-round school very explicitly.
Yep.
And essentially said for everybody that was approving these calendars based on what year-round looked like, no, we'll tell you what year-round is. And they did. And our current year-round calendar, or flex calendar as we call it, fits that definition. And so those kind of two things were happening at the same time as it related to calendar creation.
So most of the time when you have a law, and most of these guys can attest to it, you break, you don't wear your seatbelt, X happens, right?
Right.
Potentially.
Right.
You speed, this is potentially what will happen. That's typically, you have a law, and then there's a statute that deals with that. Like literally, like if we said, no, we're gonna do the 15th, and they said, oh, you could potentially lose funding, like in that law, does it say the superintendent doesn't get paid until you fix your calendar? Does it say that we would lose 10% of funding across the board? What does it say?
To my knowledge, nothing like that. There are some places that the law does say, like class sizes.
Right.
If you don't comply with class sizes, it does specifically say that can
Absolutely.
impact the
Yes, we've been
superintendent's
through that one.
salary. There is nothing related to the calendar that specifically states. And going back to, I guess, the point of right in the before times, there were several school systems that did start early, and nothing happened to them. But like Dr. Bryant said, the legislature clarified they were trying to do a creative interpretation of the law, and the legislature clarified they could not do that. And then I have not looked recently at the letter that came from DPI. I just remember that, and I don't know, Dr. Bryant, if you remember the specifics of that, but it basically said school systems that are doing this or thinking about doing this, you can't do this. But that was a couple of years ago.
What we talked about that Ms. Lopez is speaking to, that the legislator was very clear post what I'll call March 2020 about what the calendar could look like for just last school year.
Then they tightened it up.
And then and they said, yeah, you can start a week early, and here's why, and here's what the days have to be, and those kind of things. There was intentionality around this being a one-year exception. I have not seen anything from the General Assembly or from our legislative leaders that indicates that that flexibility exists.
It just seems that our legislative leaders here in this community are scared of Mr. Phil Berger, who has championed this calendar law. Period.
That would be true.
And I would like to see, we've been talking about this since I've been on the board. I don't understand what the big deal is. We've got a letter from the Camps Association that said, hey, as long as you're not going into the summer and you're not going, we don't want to go to school forever. We want to start the middle of August, we want to end our semester at Christmas, and we want to end at Memorial Day at the end of the year, right? That's it. We don't want to go into June, July. We don't. And I don't get it.
Well, I'll tell you what I've done. I have emailed all of our calendars to Representative Jake Johnson, Representative Tim Moffitt, and Senator Chuck Edwards. I have spoken, I've not spoken with Chuck yet, but I have spoken with, I've spoken with someone in Chuck's office, and then I've spoken both with Jake and with Tim. And last year, Jake and Tim wrote a bill that handled this for us, that we could go, back to the 15th.
It never made it out of committee.
It it made it from the House, but it never made it past
The Senate out of committee
Senate.
because Berger said no.
Yeah, I don't know if it was their Rules Committee or their Education Committee, I cannot remember. But they are going to be pushing hard. In fact, Representative Moffitt told me that he was gonna meet with Phil Berger about this. And I'm not done. I'm going to, try to get down to Raleigh to meet with these gentlemen, Mr. Berger, especially, and try to champion getting this done. One thing that did really come to light is, for me, it is huge that we end before Christmas so that these kids, there's like 150 kids that graduate early. That's a lot considering we have, like 1,000 seniors. Yeah,
We want
that's.
people to go into the workplace, right?
Right,
We
yes,
want them to go into
and-
secondary education.
Right, and that would allow for that. So since Veterans Day is our only holiday, we could continue this calendar out, and Christmas Eve is on Saturday and Christmas is on Sunday, so we could just do those 2 weeks and finish. I wonder what our legislators would think about us hearing from parents of us doing that, because they won't move us back 2 weeks.
Yeah, I've just never got it how community colleges, how every system in the UNC college system can start at a specific date, but yet
We can't,
we can't.
right.
And I think to help illustrate your point, if you look at the early college calendar,
It's perfect.
it's exactly what we would prefer. When you look at how that would be built, when, we had these conversations with the North Carolina Youth Camps Association and understanding what this board's desire was, to start no earlier than August 15th, to find yourself right in that space. And so you would have a middle of August start date. You have balance in the calendar in terms of the available instructional hours before winter break and after that winter break. And all of those students, as you mentioned, would be able to articulate, they would be able to enroll, they would be able to enter the workforce. There'd be opportunity for that. Not to mention, which also was very attractive to camp associations and otherwise, finishing before Memorial Day.
Yes.
An opportunity for us to sort of say, that's workforce availability at that particular point. And so if we were to draft, if this board said, draft a calendar that fits our desired outcomes, I would just like the public that you've given the plea to and this board to see, this is what that traditional calendar would look more like. Is that helpful?
I think if 50 to 100 parents out there would write the General Assembly, that might make them listen if you're interested, and to call Dr. Bryan and get the specifics of what to write.
Yeah,
If, if we could pull together here, I think that would be 50 votes that might shake up some of ours. But, I just think parents would have a lot, or teachers, I think would have a lot of say-so.
You would think they'd be stressed right now because they're taking exams this week, right?
That's correct.
Yeah.
Yeah.
And how many is going to be absent,
And how
and
many
then how's
kids are
going to make
we
them
going to
up?
have out? And,
Right.
it's,
Not to change the subject, but there is one other little bitty detail here in this calendar that concerns me a little bit. I love having in January the 16th and 17th, having the 2 work days there. I think that's when we're changing semesters, but I see that it's a district professional development day. So I would just ask, unless there's something really pressing for our high school teachers, that we reserve that and don't have district professional development for them on that day so they can turn over, the school year. But I know how coveted those professional development days are, but unless it's just something absolutely pressing.
we'd have to put one somewhere else, right?
No,
No.
the day could stay required, but as Dr. Revis is saying, it's just thinking about who's getting to dictate how the time's being used. And so we certainly would be sensitive about that.
Yeah.
We like to designate those days in advance, and a lot of times they might mean a particular group. Maybe
Exactly.
we're talking about elementary education has specific training on those days or otherwise, but we certainly would be responsive to that. Yep. If there are no questions about the early college or the traditional calendar outside of just first reading, we'll just take a look at the flex calendar again.
Before you go on,
Yes,
so did you say that you're gonna rewrite this to what that y'all see?
I think he was saying that what he would like is that if you go to the last calendar, the early college calendar, that's what he would like this traditional calendar to look like.
And are we gonna prepare that to be able to show to people what we would prefer?
We've presented all three calendars to our legislative leaders, and I think
I gave them these.
yes, sir, any member of the public, if they're crafting a letter to a legislative leader or lifting up and saying, how can I help? We would say, look at the early college calendar and think about it through the lens of the traditional calendar. That's our
I think one thing we have to be careful of is we don't want to confuse folks because, like I was joking a bit about whatever on the law, we're going to start on August 15th, but we have to give parents the dates of when school is going to actually start.
That's right.
What are those breaks? And then we don't want to, we can always come back and tweak because we have to have a second reading second reading on this next month.
But if we vote for the first one, it looks like we're in favor of it. If we vote for the draft.
True.
I'm with you there too.
I mean, I'm just thinking, if we have it drawn up, this is fine, but just to our legislatures, if we have it drawn up, say, why wouldn't this work?
He sent it to them.
I sent it
Exactly
to
like
them.
that.
They have it.
The new schedule.
The early college.
Yeah, they have all three calendars, and I said we would like to mimic this. Like, they got it.
What I would ask this board to think about is, we do get lots of questions about what our calendar is going to be for the upcoming school year. And so approving something helps people have at least a frame of reference. But the board could also communicate to the public and certainly to the administration that if any flexibility were to occur prior to, let's just say, April or something,
Yes.
that we would modify the calendar as preferred. But that helps people at least have some sense of what's going on, because it has been our historical practice to read calendars in January, approve them in February for the upcoming year, because it also impacts how we plan and prepare ourselves.
One more thing.
Yes, sir.
So there were many, not many maybe, but other districts that were proposing a calendar change last year.
Correct. There were a ton.
Yeah.
Yes.
Okay, and then the legislature came back and said, this is the way it is, correct? Or something like that. Okay. What happened to all those districts?
They got in line, though, correct? Didn't they?
Well,
That's
nothing.
what I'm wondering.
Well, nothing. Remember, because the state approved a revised, because we were responding to the pandemic, all those folks got to start early anyway, and we all did. So when they say nothing happened, there was nothing to happen, because the whole state moved up a week.
But that was for 2021.
Not
Now
for
for
19.
21, 22.
They took that, yeah, I'm not aware of anybody that started
Right.
early this
I
year.
mean, we were talking about doing, turning.
So again, did they fall in line?
Yes.
Yes,
Yes.
to my
They all
knowledge.
fell in line.
Yes, sir.
We know.
To my knowledge, yes, sir. I don't have every calendar, but I'm not aware of a single school district in the state that openly defied the current calendar law.
There was talk about going to the year-round schedule, right? And that's how you were getting around it. And then as soon as they changed the schedule for 2021, they, with that law as well, they tightened down the screws on what is classified as a year-round school. Or
I have a question about that. The robust learning that we are learning during the summer, can we check to see if that falls in line with year-round? Because we didn't even have that. That got made up last year.
So at my last reading, the robust learning requires it's accessible to everyone. And you remember, our summer learning is not 13,000 students. It's a portion of the students, but we'll gladly evaluate all
semester dollars.
I'm sorry?
Yeah, we have
Say
semester
ESSER dollars, right, yeah.
Open it up.
Well, we need the employees.
That's right. A quick note about Flex. Flex is pretty straightforward. It does, as I mentioned, follow the calendar definition of year-round, which essentially means you go to school for 45 days, you're out for 3 weeks. You go to school for 45 days, you're out for 3 weeks. The only place where that's different is in the third quarter going into the fourth quarter, because we recognize that for parents and families, keeping everybody on the same spring break was really important. But they also still have the day out around Easter as well. So that keeps those consistent, which essentially allows for actual spring break, and then something of a secondary spring break for all of our school calendars. And this calendar is not terribly different than those that you would normally see, other than the fact that there's an opportunity for the professional learning to occur at the beginning of the year. Part of the feedback that we do hear, and just want to share with this board very, very frequently, is it's challenging to have people out of school in the middle of a week, right? So when you look at that DPD, those have historically lined up with the district-wide efforts that are going on, so the staff at the year-round schools can also participate in that. So we're always evaluating how we can do that work in a more efficient way and benefit the continuity of students. But this calendar is pretty straightforward and very familiar. Remembering this board suspended year-round calendars for just 1 year when we were in that space and then brought them back this year. Glad to answer any questions.
I'm beating a dead horse, but why can't we give that calendar and the traditional calendar to parents if they want a calendar and say, we are working on this
Let's
in
do it.
hopes that.
Let's do it. Let's put
And
off
they would
traditional calendar
have
for a
at
month.
least 2 to look at, that it's going to be this or that when we finish.
You certainly can.
This is what I'd like to do.
Let's approve.
I want to approve the flex quarter and the early college calendar. I would like to write an official letter, not an email, from us, if everybody's willing to sign that we are looking to move our traditional calendar to the to what our early college calendar is. Let's get that off, and then we will table the traditional calendar until next month.
Yes, sir.
And Amy, I appreciate you on our behalf of getting to the senators and legislators to let them know how this impacts our students and their learning. So I appreciate that.
And Jake and Tim both said, we're on it, we're not stopping.
Good,
We wrote that last year, but it's coming back again this year. We're gonna try to get it pushed through.
good.
So,
Well, I'll go ahead and make the motion and get this moving. Where's it at? I'll move that the Henderson County Board of Public Education approve the 2022-2023 flex calendar and early college calendar for first reading.
second.
All those in favor say aye.
Aye.
Any opposed? All right. I don't need to make a motion to table the early calendar, the other calendar, right? We just table it. Sweet. Moving on. Oh, this is a fun one. North Carolina lottery application.
Can I ask the question?
Yes, this is where I really miss Mrs. Korn and her poignant questions on this. But we're going to let Mrs. Holt take her place this year. Mr. Sessions, take it away.
Yes, sir. It is lottery application time, yes, as you pointed out. There's $325,509.68 available in the lottery pool for us to draw down. The county commissioners have already signed the application that is attached and signed, and for our approval to sign to go towards the debt service of Hillendale and Mills River Elementary School. And it is here for your approval.
So let me ask you about this, this lottery money. All the lottery money that, when people buy tickets, all the money that makes, that goes right back into education, like 100% of it, right?
That is not correct.
It's not?
There is a percentage shy of 50% that goes directly into education.
Wow.
And that's just of the net proceeds.
That is a proceeds.
See, but it says education lottery, like,
The rest goes into the general fund. It's crazy. Whatever. We got to approve it. You might make a motion.
I move that the Henderson County Board of Public Education approve the Public School Building Capital Fund North Carolina Education Lottery application.
Second.
All those in favor say aye.
Aye.
Any opposed? It's approved. Next, sole source, Mr. Bernie Socha.
All right. This next one is a sole source approval for Pearson. They provide an assessment tool for our EC department. That is one that has been used in a pilot model for the last couple of years on a very small scale that has been successful. They would be used for assessing in the psychologists and the speech therapists to do online assessments. What they have found that it will cut the time for the assessments approximately in half. So they would like to expand that to the district level. And so to do so, we would like to use Pearson as a sole source. The application is there. DPI has approved them as a sole source for us, and Pearson has provided the documentation that lists all of the things that they provide that they are a sole source provider of, which is like a 5-page list, I believe.
These come from EC funds?
Yeah, we're going to use the ESSER funds for this. Yep.
I move the Henderson County Board of Public Education approve the specified vendor as a vendor under the sole source exemption guidelines.
Second.
All those in favor say aye.
Aye.
Any opposed? Thank you, sir.
Thank you.
All right, so this is a good one. Employee eligibility criteria for state ISP bonuses, Mr. Scott Rhodes.
Thank you, Chairman Craven. We would like to bring to the board this request that employees who are qualified as instructional support personnel as defined by the state of North Carolina Department of Public Instruction, these folks have an opportunity to earn a $1,000 bonus out of ESSER funds. We have to approve the criteria for these individuals. And to determine that criteria, it's going to be based off the mitigation of COVID-19 and learning loss, based off of trainings that these individuals in our school system have attended since the beginning of the pandemic. What we're requesting from you this evening is that for you to look at these standards to approve these list of trainings. We'll be sending this out to employees to get those signed so we can get those folks paid the $1,000 at the end of the month. So our request is to approve the different trainings of criteria listed in this document.
If I could add just one other piece to that. Remember, these are state ESSER dollars, not local ESSER dollars. This was part of the budget that was approved. And the legislation requires that boards of education approve what trainings took place. In order that all employees who are in eligible groups receive that this month. So as Mr. Rhodes said, these are the trainings that occurred that meet that definition as we look at it. And we are required to have board approval of what those trainings are so that those folks can receive their state money.
What are we doing for teachers who are employed from federal funds?
We have looked at ESSER funds that cover all eligible categories and all eligible groups. So if you are determined to be instructional support personnel by the state's definition, we're covering you regardless of funding source.
Okay, good.
Yes, ma'am. Thank you for that clarification. That's a really important point.
And local as well?
Everybody that fits that definition. Yes, ma'am.
And we have to have this one done by this month so they can get paid, or by today so they can get paid at the end of the month.
Let's do it.
$1,000 bonus, correct?
Yes, sir. So
I move that the Henderson County Board of Public Education approve the employee eligibility criteria for state ISP bonuses as presented.
Second.
All those in favor say aye.
Aye.
Any opposed? It passes.
thank you.
Yes, sir. Let me get, my computer just froze. There we go. What is it, ESSER? Funds for class coverage and quarantine support, Mr. Scott Rhodes?
Yes, sir. So Dr. Fry and I both are going to kind of tag team this. But what we want to bring to you this evening is a request to, in an effort to address our current substitute workforce shortage. We have a plan in place where we would like to be able to pay teachers who are being asked to cover classes out of ESSER funds until the end of the year. Obviously, we've never had the opportunity to do that, but we are asking teachers to cover classes continuously.
Yep.
So what we would like to do is to be able to pay them $30 an hour for those teachers who are covering those 60-minute classes or less, and $45 an hour for anybody who's covering a 90-minute class. This is also going to open the door for us to be able to do some things as far as synchronous instruction, and I'll let Dr. Fry talk about that, but I'll answer your question first.
You said $45 an hour. Do you mean
45 for 90
$45
minutes,
for that
excuse me,
90
yeah.
minutes
For 90
time
minutes.
period, and then $30 for that 60-minute time period?
Yes, sir. Thank you for that clarification. I apologize.
So this is primarily, the way I look at it, I may be incorrect, this primarily is helping our middle and high school teachers who have planning periods go in and cover for other teachers and get some compensation, which I'm all about that. How would that impact elementary teachers who, I mean, I don't even know how we're covering in elementary school.
So right now, we're covering elementary teachers using teacher assistants because they have such a large number of TAs. I'm not aware of any situations where we've had to have teachers covering any other classes because, they're responsible for their own class. If we ran into a situation, we could implement the same type of payment if a principal says we had to pull a teacher to cover for an hour or 90 minutes, then we would work with that principal, make sure that we were compensating that employee.
I think elementary have to go during their specials sometimes to
Yep.
cover for other classes.
And if they do, then we would make sure that we take care of them as well, Ms. Case.
So do we have any idea how much it's gonna cost?
No, sir.
Because we've written a couple of blank
Blank
checks
checks.
over the last 2 months, right?
Yes, sir.
And I would like for next month, I am perfectly fine with this, but I want to have some dollar figures attached to how much money we're spending. Right, with the substitute pay, with the bus drivers, with this, I think it's needed. I think that's what the ESSER dollars are there for. I want to make sure that we have some for the summer so we can keep that summer program going. But I need to know how much money we're spending.
Yes, sir.
And so if y'all could please bring that next month, that'd be very, very appreciated.
And just for one point of clarification, we would want to start this at the beginning of the second semester. That would be our start date.
So when's that, Monday?
That would be the following
Wednesday.
Monday. Yes, sir.
Has there been any consideration, and maybe we do this anyway, at one point, it seems like in elementary school, when a teacher assistant was subbing for a teacher, did they not get a higher level of pay than what they ordinarily, okay, so they're kind of covered,
Yes, ma'am.
okay.
So is this a bonus or a pay plan change?
This is to pay those teachers
bonus.
that are during their planning period. We're getting the emails all the time now that those teachers are working during their planning period covering another class.
So,
Right,
and then,
it's essentially extra duty
sir.
pay. It's the
Right.
same way we do anything else. So when we're saying to you, you're doing your normal job, but then when you're supposed to be planning, we're pulling you to do somebody else's job. You're being compensated for that work, and certainly we want the board to have a clear picture of what that is. And that does occur, as this group said, elementary, middle, and high, and we want to be able to attend to that in all those spaces.
Because those teachers that are trying to plan are planning at home at
right,
night.
or staying
they're
till
covering, or
5
staying
o'clock
late.
or whatever.
Right, so we want to make sure
Yeah,
we're
or
compensating
grading those
them
papers
for
later.
what they're doing during the day,
Absolutely.
for that missed time.
Like I mean, I believe it is 100% necessary. We have to make this shift. Our teachers are burned out and they're doing, I mean, it's happening every day to them. So I feel like we definitely need to do it, but we need to kind of keep tabs on all this
I want to
stuff,
know
too.
next month how much we're spending on bus drivers, subs, and all this,
Mhm.
Yeah, we'll bring you back the numbers.
and
that
some
we have.
projections.
Yes, sir.
Remember too, they're covering these periods because we didn't have a sub for those periods.
Right.
So we're not paying a sub.
Right.
So it's not an exact wash, but,
No, but it's coming from a different
It's a different
pool
fund.
of dollars,
right,
Yeah.
right.
right? And so
Is
I
that
just want to
state money
know.
correct for subs? Is that state money that we use for substitutes? It's local?
It's local.
It's local.
It's local. Oh, I didn't know that. I always thought it was state. Okay.
So that could be some money freedom, yeah.
Could be.
You want
I'm
motion?
interested to hear about the synchronous instructional support for quarantine students. What are you thinking about there?
So additionally, we want to compensate middle and high teachers. I'll start with that group first, middle and high teachers for giving up their planning periods to provide real-time synchronous support to students who are quarantined. We want to make that available to our core academic teachers so that they can do that for all students who are quarantined on this day. I can provide online real-time support to those students. And then the model that we would like to use in elementary schools is this. We would like to hire 2 elementary teachers to work under the direction of our Director of Elementary Education, Dr. Shannon Marlowe, to be housed at Mills River Academy to have access to resources at Mills River Elementary and teachers there. But their day would look like this. The 2 teachers, one would focus on K2, the other would focus on grades 3-5, and then they would spend approximately 90 minutes with each grade level. So if I'm the K2 teacher, 8 to 9:30, I am meeting with all quarantined kindergarten students in the county. Then the next 90 minutes, first grade, the next 90 minutes, second grade. Now you may ask, well, there's no way you can keep pace with all of the different schedules that are going on in the county, and that wouldn't be our intention. Our intention would be to teach and reinforce application of skills that are appropriate for that grade level, and then using our iReady and our DIBELS data to reinforce those areas of deficiency across our county. And then use the afternoon then to connect with families and to schedule students and their meetings the following day. So we really are excited about this opportunity.
We still have district curriculum calendars, so they can, they
Absolutely.
know where they are in the
We
ballpark.
can approximate it for
Yeah.
sure.
Yeah, that's great.
Hired other people to be the quarantine people?
So yes, ma'am, and those are TA assistants to be the liaison between the schools and the families to answer questions, to make sure students have what they need, can access their Google Classroom and so forth. But those are not certified positions. What we're proposing here in these elementary positions are 2 certified elementary teachers.
These would be individuals that would actually log on live with students and families to provide direct support. So different than a quarantine TA who is helping to facilitate and really keep connected in terms of assignments and otherwise. What we're talking about is coverage for certified personnel that could provide that direct instructional support.
In addition to, they're going to be doing a lot. That's a big job.
Have you identified those 2 teachers?
We have not. We're just seeking your approval.
Well, I move.
Those would assist the quarantined individuals.
Yes.
And then what happens a year from now, or
This is to the end of the year.
Yes, sir.
Both of
And
these.
yes, sir. We would love to, if needed, continue them.
We'll have
We'd like you to
positions
bring that
open.
back to us.
Yeah.
Yes.
This is the end of the year.
No, ma'am. So to answer your question, we would have 2 teachers. One would serve kindergarten through 2nd grade students. The second would serve 3rd through 5th grade students. And then meet an hour and a half with each group. So for example, from 8 to 9:30 kindergarten students, and then the next 90 minutes 1st grade students. And so, yes, we would segment them by grade.
and we would look for a teacher saying this is a job for a year?
Yes.
For a year.
Well, for 6 months.
We, through our ESSER.
What are you asking us for?
Through our ESSER funds, we can advertise this as a 2-year position based on the ESSER allotment that we are seeking it from.
And if we work out of the pandemic, I'm sure there are always openings that we could slide them into.
Mr. Rhodes would love to have
Yes.
more people to slide
I'd
in.
like to have 2 extra teachers in my pocket somewhere where I could put them.
Yeah.
I'm sure we will always need them. I don't think it, and again, it would be coming out of, again, that would be coming out of ESSER funds. So if those 2 positions were available and we didn't need them, there are places throughout the entire year where we have interims in places where we would be able to place them.
I don't
Without
think we
question.
would have a
No, and I
good
think.
chance of hiring somebody just for 6 months.
Right, and I would just remind the board, I think one of the things we talk about a lot is we all work for the school system, where the needs are. And so sometimes we attach ourselves to very specific assignments. But if we no longer needed to provide quarantine support to a student live and in a synchronous way, just as you're saying, Dr. Revis, and our vacancy is in a 3rd grade classroom at an elementary school, and we have vacancies all the time, you can be assigned to that position or do something else. So the concern is not the employment opportunity. The concern is, again, we want to work ourselves out of that job, right? We don't want to be providing support to quarantine students forever because we don't want quarantine students forever. But we continue to hear from this board how important it is that we have a more robust version of live access to be able to provide that support, and that's what this intent is.
And I agree with, go ahead, sorry.
No, go ahead.
And I agree with that. I just want to make sure budgets always, these alarm bells always go off that I can see where we keep adding and adding and adding, and then budget time, we keep asking for more and more and more. I mean, yes, it's covered right now, but eventually that's going to run out, and we're going to feel obligated to keep them employed and shift them around and keep asking for more and more money, and we're not going to be able to keep asking the county for millions and millions of dollars every single year, because eventually we're going to do this. And I just want to make sure that we're not creating.
We'll have like teachers that retire and they can move into their position or
That's
move
fine.
or whatever,
That's
yeah.
what I always hear whenever we're adding. I'm like,
Look,
I
this
know.
is
Yeah.
ESSER dollars, remember. So this is
That's right.
the federal dollars that are coming down. This is not adding to our local current expense.
that's correct.
Now,
What is it
It will run
for?
out.
in 2 years, correct, I mean, we're gonna have to, when
Yeah.
that money is gone, there's a lot of things that we're gonna have to look at. Our summer school, the summer program, I mean, we have to look at a lot of things. But for now, we need to do everything that we can to
I agree.
provide the best education that we can to these kids, so. Again, how much? How much is it gonna cost us? And when do we start implementing this? I know you're probably starting to do this immediately, hopefully. I'd like to see, again, next month, how much we spending.
And since you brought up the liaisons, I keep getting complaints from parents that they are not hearing from these liaisons. Some of them, like an email that we got, it was either this morning or yesterday, said 7 days, didn't talk to the teacher, didn't talk to the liaison. And I keep hearing that over and over and over again, probably 10 times a month. And it could be that the teachers' assistants that we hired to go in and do that, they're just completely covered up and we need to. I don't know, but we're looking at this for elementary, so maybe in the middle and the high, we need to hire an additional person there to help because it's just so overwhelming right now.
It'd be real helpful if there are specific examples like that to either direct those folks to call instructional services or just forward those along to us so that we can tackle those on case-by-case basis. Because I know that we have a number of TA quarantines who are doing an amazing job, right? They're staying, so if there's specific instances in which that's not being met, please direct those right to us.
Okay.
That'd be great. Thank you.
I've got one more comment, if I could, I'm sorry, if I could make one more just comment.
Please.
Have you thought about also trying to provide some extra financial incentive pay to teachers who may be willing to teach virtually and face-to-face at the same time? I know I know nobody wants to do that, but could we throw that in the mix here if there was someone who was willing to do that?
Well, I think as we've talked about before, we're willing to kind of explore every option
Yeah,
in that
let's-
space. Right now, we have been pretty clear about trying to avoid hybrid situations,
Right.
in that space, as we're just keeping things covered. But as we look forward and look at what's moving forward, exploring that as an option and seeing if there are staff that are interested in doing that, that can be the kind of work that we spend a little bit more time learning about.
Right.
Scott, how many bus drivers did y'all get out of the Molly Scott advertisement, which was great?
So right now, those advertisements just started, and so we've not really been able to see the effect of that initiative just yet. But hopefully, what we'll be able to see here in the next month or so through our board report as far as the number of bus drivers that maybe we hire, I'll be able to report back to you, and hopefully with good news.
I know one school anyway that we may close down because we don't have any bus drivers. Where are you going to get those to take it over, John? Where are we going to get any bus drivers now because the DMV's not offering the
That is a
driving?
challenge.
There are school systems that aren't picking kids up. In Greensboro, I know for a fact that they have shut down many routes because they don't have bus drivers.
Where I just want to praise our school staff, our school administrators, our teachers, our coaches, we have had people pitching in every way you can possibly imagine.
Yes.
But as you ask, that question is exactly the kind of question that requires us to move to a virtual learning space when we don't want to. We can't transport kids, if we can't teach kids, if we can't provide that kind of instruction. But what we've seen across the board, we've got some administrators that are driving every single day. There are teachers that I know that are delivering instruction that are driving every single day.
And it's burning them out.
Most certainly it is. And we can acknowledge both those things and at the same time knowing the reason we talk about preserving face-to-face instruction is exactly that, right? It is doing everything possible to make that happen. And so those are the real implications. But I applaud this board for incentivizing that, for bus drivers, for substitute teachers, for class coverages. I don't think you can realize how much that's going to mean to our teaching staff to say, I see you and I hear you and I'm going to take care of you in that way. And then to continue to do everything within our power to create as much of a stable auxiliary workforce as possible. Yes, ma'am.
Blair, I've got a suggestion that we write the DOT and tell them that, they need to pitch in here a little bit too and get more than one person to cover all of western North Carolina driving our bus drivers to keep the kids coming to school.
Yeah, we had a robust conversation about that at rugby on Wednesday, and the amount of driving that the, administration is doing to get kids back and forth, and they actually shocked me. So in my mind, I heard Mr. Rhodes bring in this great program that we're doing, and we're recruiting and everything, but I was told that it is like between 5 to 8 months from when we hire to when that person can start driving, because the DOT is so far behind. And
To get their CDLs?
yes,
How long is it taking?
would you say that's accurate?
Uh-oh.
Look,
I would not be able to tell you accurately exactly what that is, but I would also just say this to you. That whole proposal was really twofold. Really having the opportunity to be able to pay our custodians, our coaches, anyone who's driving that bus and is driving over the certain number of routes per month, that was really the main purpose. Being able to get someone else who is willing to come into that space and to apply to be a bus driver, that is almost like icing on the cake at this point, because we are struggling. It's not only that, but the whole health, the guidelines for someone to be approved to drive. Like, we've got one individual who wants to drive, but every time he wants to get ready to go take the health test, if your neck, I believe, is over 17 inches, then you have to go do a sleep study.
Are you kidding me?
yeah, it's
No,
crazy.
I'm not. Now, again, let me just say this, because I know this is live and in person. That's secondhand knowledge. But I trust this person wholeheartedly, because, again, they have attempted this on 2 different occasions. And so the frustrating part of this whole equation is not only is it hard to get people to get them their license in driving, but some of the hoops that we have to jump through are frustrating as well.
How many people do we have that's had the class and got there, they have to have go to the doctor and get a physical? How many people do we have waiting to drive with that one guy who's got all Western North Carolina?
In this case, I don't know that.
Wait. So are you telling me even like truckers?
Right, the CDL requires a state medical card now. That was one of the new requirements. This is anyone that carries a.
If we have anybody that wants to drive an 18-wheeler, they have to see this guy?
No.
Okay.
He's training just people that are learning to drive a bus, but they're serving multiple areas. And so every school system has the same problem. And that is, we can get people to take the classroom portion, but then they're waiting in line for the driving portion.
That's right. But can we not work in tandem with wherever these truckers go? I mean,
I believe that's what Ms. Case is saying. We are required to have people trained for the bus driving CDL through the DOT personnel that does that training. And so I think her question about,
You have to get it from that.
are there other folks, the DMV and otherwise, that can provide a different series of training? Can
we not go to where the truckers are going?
I don't think so. I think it's right through the state.
It is different licensure and different
CDLC
training.
or
Yeah,
So-
PNS endorsement.
Back, Blair, I think we, as a school board, should write a letter to the DOT and say, it's time that y'all do your share too and help us get these bus drivers to keep our kids in school.
And maybe,
Dr. Bryant and Mr. Rhodes, you guys are going to be writing a lot in this next.
and maybe copy
help us
that,
craft something.
copy that to our legislator.
Sure.
Right.
Because they need to know that we're having this issue. I'm sure they have zero clue.
I hope they don't look at my shirt size. I won't have to take a sleep study to drive a bus. Goodness.
Would it help if the commissioners were on it?
Yeah, probably.
If everybody wrote them, they've
Why
got
don't
to
we get
pay
everybody
attention.
on it?
And parents out there.
Okay, do you want us to make a motion?
Yeah,
so we
let's
can
make a
approve?
motion.
I move that the Henderson County Board of Public Education approve the ESSER funds for class coverage and quarantine support as presented. Anybody got a second?
Was that Dr. Revis? All those in favor say aye.
Aye.
Any opposed? It passes. All right, return to learn. We've already
No,
did
we've
that,
already done that.
so-
Yes, sir. I'll just give a quick update.
Do you want to do on the test to state? Yeah.
Right, and really, just share with this board, we are continuing to proceed forward with every option available to keep kids in school. And in short, I had shared with this group that previously the ABC Collaborative was a research study that existed within the state through Duke University that was working with school systems to determine whether or not data sets supported quarantine students and how that looked moving forward. And we were moving in the direction of engagement with the ABC study. What we have learned since then with the revisions to the toolkit is school systems can implement their own test-to-stay studies if they have the capacity to do so. So one of the things that we will continue to do moving forward is outlining what those options are. Ultimately, they are dictated by what we've already talked about: personnel, supplies, and logistics. Right now, the capacity is such that the earliest we might be able to embark on something like that, because we just were recently eligible to even participate in something like this, would be February 1st. And we've had tremendous support from our health department as it relates to the planning and the logistics associated with that. So we are going to continue to proceed in that direction so that we have options for this board as it relates to what we've been talking about already, having the ability to administer a test or otherwise and ensure that people can stay in school with the most minimum of disruptions. And that becomes far more viable in circumstances when case counts are lower, when you're not dealing with the numbers like we have right there. So just wanted the board to... Oh, yes, ma'am, that's what I say. Supplies are critical. Right now, when you hear your medical leadership talking about supplies are limited in hospital settings, we certainly are going to be secondary to that space. But we continue to receive support and direction from the state of North Carolina and otherwise about the additional resources that are available to us. So what I've heard from this board is a desire to have every strategy in place possible, and so we're going to keep moving in that direction.
Jay, are you good with test to stay?
Absolutely. I'm good with anything that will separate the quarantine from the positive.
So I just want us to make sure that we are reassuring our teachers that we're not going to have them testing and swabbing students.
No, ma'am. One of the things that we do know is that most students, and I'll say grades 6 through 12, can swab themselves for what that would look like. But we know that there's staff support that's necessary for the logistics in the elementary end and really that K2 end. That's not uncommon, but that's kind of what we're having to work through, again, is making sure that we have the support associated with that. But anytime we have kids anywhere, it requires supervision. Anytime we do something, it requires coordination. Anytime we have a new initiative in place, it requires clarity, and we want to make sure that we get those things right. So that's what we're working toward. Appreciate that.
You guys are great doing all this. I don't think any of us would disagree with that. That
So,
you guys have really.
we done? We good with return to learn?
Well, I got one more thing.
Yes, ma'am.
Did we feed the kids that parents couldn't get there today? I heard somewhere that the cafeteria would have packets to pick.
Yes, ma'am. We had
parents to
grab and
pick
go.
up.
We had grab and go meals.
What
So-
about kids that parents couldn't come get the food? Did we feed them like we did last year?
So one of the things that our staff has gotten so good at through this period is understanding where that need lies. So what immediately often happens is our counselors, our social workers, our support personnel are reaching out to those folks and
2 or
providing
3 can go
support
home.
if necessary. Yeah.
Just you.
Thank you.
Yeah, I am. We're gonna keep 1 or 2. Sorry.
Would you like me to move into ESSER update?
Yeah, Dr. Bryan and I had talked about putting a standing board report on the ESSER update. And I'm going to hold it off this month because I want it to be more robust than what's in here. I know it's going to show what we spent money on, and that's great. I want to know how much money.
Sure.
And so next month, I want it to be a little bit more robust, and I want to know exactly how much money that we are going to be spending and what you can reasonably project going forward. Is that fair enough?
Yes, sir. And that's, as we talked about, that's our intent moving forward.
Yeah.
One of the clearest data points we have is when we think about PPE and what summer school cost us. We can tell you
Sure.
pretty clearly on those, right?
Absolutely.
As
But
we
other
start-
than that,
Well, right, we'll pay the retention bonus in February, so you'll have an exact number down to the penny. But you'll also have data around 1 month of incentives for bus drivers, substitutes for coverages. So we'll be able to make that more of what I'll call a financial report than a global report. So yes, sir,
is that okay with everybody? Like, we were going to add that this month. We were talking about we need to have a standing ESSER update on where that money is, but it's really helpful to me to know how much. I know what we're doing. I know how much it's costing us. So we'll skip over that one for this month. Right.
John, have the teachers got their supplements, their first part of their supplement And did we give them a bonus?
February for.
They get paid the bonus in February, the retention bonus that goes to all,
Us or from the state?
from us. One of the bonuses that they get this month is the one that was state legislated. And the first portion of the increased local supplement was paid in November to employees. Yes, ma'am.
All right, let's move on to the calendar for the 2021 budget development. You have it in front of you.
Thank you very much. So if everybody just referenced the handout that I put in front of you before the meeting got started, there isn't anything linked there, and it's because we want to just talk a little bit about the dates and the times. So we are required per policy to outline a budget planning and adoption process. You all are familiar with this process. It starts with actually a presentation next week. It's an opportunity for me to go in front of the Board of Commissioners and share an overview of the budget, what the impacts are associated with state budget, the state budget approval, and how that affects our operations. We'll have a workshop. Our first will be on April 13th. I'd like to propose that that meeting is from 9 a.m. until noon, and that we would meet here and then feed lunch if you all are interested in that. We've had a secondary board workshop, always scheduled if we needed it, to follow up with revisions and requests and additional information from the board. That would be April 28th. Again, proposing 9 a.m. to 11 that day, and again, only if needed for April 28th. May 9th is the date of your regularly scheduled board meeting, so that's the day in which you would actually approve the budget, because we have a statutory requirement to transmit that budget by mid-May to the Board of Commissioners for their consideration. And where that stands this year, I believe May 15th is the actual day, but May 15th is a Sunday. Unfortunately, the Board of Commissioners said you can bring it to us on Monday. So it goes to them on May the 16th. So again, our budget adoption process would be initial presentation of the Board of Commissioners as part of their budget workshop next Wednesday. We would meet on the 13th, 9 a.m. to 12 p.m., and then we would do we'd feed you lunch afterwards. April 28th, 9 a.m. to 11 if needed, and then our regularly scheduled meeting on May the 9th. Welcome any feedback, questions, or concerns.
Any of those dates conflict with anything that you have in your calendars? Really, the most important one's going to be the 13th, and then that May 9th, which is a regular scheduled board meeting, right?
Yes, sir, that's correct.
John, do you want us at these other two to back you up and look like we're in agreement?
Oh, I love when we're all together. Yes, ma'am, absolutely. That'd be great. Again, the Board of Commissioners, I'll share that slide deck with you. They hear from everybody over a 1.5 day, 2 day period. And so they need some initial guidance about where all the different pieces to the puzzle are going to lie. The 13th and the 28th are, of course, us, and I propose that we're in this space because of the setup that we now have here. That can be a meeting that's projected. It can be a meeting that people attend, whatever the board prefers. And then the May 9th meeting, of course, we're back together, and then they'll ask us to go and formally present again to the Board of Commissioners.
In this case, typically the chair or the vice chair go with the superintendent during those meetings just to follow up with any questions that the commissioners might have, especially the May 16th is where the rubber kind of meets the road as far as our budget goes for next year.
Don't have to.
Everybody's welcome to come.
Is the 16th, that's not one of their meetings though, is it?
No,
That's just when you
That's when they.
that's when we have to send it. They'll tell us when they want us to come. It generally is the meeting that follows that one.
Yeah, that Wednesday, right?
Yeah.
Yes, ma'am. Mhm.
I have a request.
Sure.
If it takes us to a point, or 2 meetings, I'm totally fine with that, but can we get some kind of a spreadsheet, and some time, an hour or so to go through, programs that we implemented and money that we asked for, and where those programs are now? If they were discontinued, where did the money go to, et cetera?
Blair's thing.
Talked about this a couple times.
Listen, I'm a beat that dead horse that Miss Case was beating on earlier, and this is, I think, our only job, our number one priority aside from hiring a superintendent is knowing where that $28-30 million that's locally appropriated goes. And it's not only your job to know where it's going this year, but where it's been in the past. The state dollars, the federal dollars, we really don't have any control over that. For the first time this year, we do with the ESSER funds. That's completely out of the norm. It's never going to happen again properly. But that $28-30 million, you have to. That's what you are accountable for to the citizens of Henderson County. And I have asked for that, and I have seen it in grand scale. But yes.
Well, let's have an example.
What I'd love to do,
You want me to get my first softball lights? Mine, and I hate to harp on this, and it's Mr. Scott Rhodes, and man, I love you, man.
Just as an example.
It's because it's when I started, right, in 2016. We started middle school baseball. We put $40,000 in the budget. About half of that money that's in that budget, that's a recurring expense each and every year. So about $20,000 of that is going to pay supplements-ish, right? And then the other is at the discretion of the athletic director, right? And so it is of my opinion that the discretion belongs to us on the board.
Yeah, and I mean, just to, like him saying, hey, this other 20 needs to go here, and then us saying,
Done.
okay, here we go, or we don't need it, and it goes back.
I think even bigger is like the programs that were bought 20 years ago for X, Y, and Z are now being repositioned for, ABC. Cool. It could be local dollars, yes, ma'am.
That's gonna take,
Forever. I mean, but I've been asking for 5 years.
what'd you ask for?
Well,
An hour?
Like typically we'll just do the first workshop and not do the next.
Yeah, typically.
If we could, I don't know, maybe like get the spreadsheet at the beginning of April so we can start to look at it and then.
Even if you could 30,000 foot view it, and then you can kind of dig into it, because I know we're asking a big pull. It's on Bernie, right?
Well, I think what we would love to do, though, is to build a format that helps educate the board and communicate what that looks like. Because I think, to the board's point, you do need to be informed about where those dollars are, where they're assigned, and how they're being allocated, much in the way that we are modeling with this ESSER process. You hire us to make those decisions, right, about what the needs and the priorities are and otherwise. The oversight of the board is an opportunity to talk about the governance associated with that. But I think one of the challenges has been the way in which those dollars are reflected don't always make a whole lot of sense year to year to year to year to year. And so a way in which we could map that out would be, I think, helpful for all of us through the budget process. So I would love the opportunity for us to sort of talk about some of that programmatic work, to put it in a form that is clear to the board and clear to the administration and clear to the public, and then talk about what that looks like year over year. So we welcome that challenge, right? I think
It's a big challenge, it's a big push, but I think it's important, especially every 2 years you've got new people coming on the board, right? I think it's imperative. Yeah. Yeah, I'm fine with that. I mean, I don't care how it was spent 20 years ago.
Right.
I
Yeah,
do
I-
not.
that's not,
We're still paying.
yeah,
Yeah,
that's
I-
definitely not what I'm asking for.
I don't care what it was spent on 20 years ago. I do care how it's allocated today, because since I've been on this board, we've only allocated really, say $5 million in new dollars. Now, there's a little bit of differences there because we had the Mr. T money and there's some different things that we were doing. But typically we add $1 million every year. And it's stuff that's needed. But I have no idea what happened for forever ago. I can account for $5 million of 30. Sure, let's pick it this year. Where's that money at? Where's it going? And then we go from there. I'm down
I
with it.
think what you're talking about is exactly what I'm talking about, right?
Yeah.
Which is to establish a clear picture.
Sure.
And a format for our process. So that we have a vehicle and really a model for understanding how every dollar is spent. I think that would be helpful for everyone.
And it's in code, correct? So.
We'll translate, that's correct.
That's right. You
That's
can't-
correct.
Yeah, okay.
Yeah. All right, questions on that stuff? On the,
Any objections to the days or the
dates?
times?
Yeah, sorry, I lost my train.
That's okay.
There for
No, but could you email?
Oh, yes, sir.
Stephanie will email these out.
Times.
You'll get all this fall, but we didn't want to add any of that until we had a sense of where we were.
Thank you.
No problem.
All right, moving on. Construction update.
I would like to reprise my role as Assistant Superintendent for Administrative Services for just one moment. And just give you a quick little construction update. Again, these are things that you are familiar with, projects that you've seen before. And again, progress is being made. Very, very exciting when you think about the auditorium space at Hendersonville High School, what that looks like, where it is, where it's going.
Wait.
Drywall's up.
Yes.
How are we looking at that?
That's looking out towards the,
There, what about the bottom one?
that's the,
So you're sort of on the stage. What you can't see is this is the lip of the stage, right here. This is the lip of the stage. These guys are down on the auditorium floor. These guys are on the stage. These are the wings. So if you were standing right there and you were facing this way, you'd be looking out into the auditorium. You'd be looking out to that.
Okay,
That's the
what
back
about
of the
that
theater.
one down there?
This is the bottom of the auditorium. This is the balcony, and this is where the,
Oh,
Sambo-
that's the same picture. Okay,
Yes, ma'am.
I'm sorry, I thought those were two different ones. Got it.
When are we gonna, attack the idea of renaming the auditorium?
One of the things I was going to mention to the board is we talked about looking at that in the new year. I've had discussions with the Hendersonville High School staff, had some dialogue with them as prior to kind of being in our last area. And what I'd love to do is to be able to follow up with the board in the coming board meetings with some recommendations,
Okay.
if that suits. Great. What you see here is the future press box. So you're looking at the back of the stadium here. Again, this is a purple room. We're going to leave it purple just as kind of a prank to Hendersonville High School, because I think that they would.
Go Knights.
That's right, go Knights. We're just going to leave
leave
that space purple moving forward. I love this. This is a picture of a freezer, but this is a huge freezer. This was on your capital list, if you remember. This has been a long, long overdue need. This is over at our maintenance warehouse, critically important for support of our child nutrition program. But when you spend big, big, big money on a freezer, you should see pictures of it and its installation, and it's going to serve this school system for decades to come moving.
That does not lock, correct?
I'm sorry?
That does not lock.
It does not lock, no, except from the outside. You can lock it if you needed to on the outside. But
There's
we
not
would
gonna be someone that comes in and the door shuts behind them.
No, sir, no, sir.
They
We're
could
gonna
be
take
gone.
you there to see it.
They could be gone for years and you
usually have
wouldn't.
those emergency.
Emergency
you can
push bars on the
inside.
inside.
Okay.
Yes, sir, yeah. But if I'm ever missing, that's where to look for me.
I was like, you could be gone.
with all the
You
food.
never find all that food in there.
That's right. Here's your project update for a series of things that are taking place. Again, remembering complete means, just like you saw with the freezer, the job has been finished. Paving is, we've awarded contracts for roof replacement and otherwise. Rugby Middle School wrapping up. The warehouse is continuing through the remainder of this. And then video management and the lighting systems are finalizing contracts and then proposals moving forward. So we continue to push on that lens. Again, very, very grateful to Mr. Kent Parent, who is really an unsung hero of helping this work to get done. All day, every day is making sure that these projects continue to move forward and partnering with the county on that. These are really important efforts taking place. North Henderson, again, remember this board approved auditorium seating replacement. So you can see what's going to be taking place at North Henderson High School in terms of demo, delivery, install, and then anticipated installation. Same at Apple Valley Middle School. You can see that will be the second project within that group. And then, of course, there's a third project associated with what you see out in front of you right now. Because those project bids came in so low, we did not allocate any additional dollars. We were able to include this space as kind of we're just about to our final touches in terms of finishing up this space and how that'll look, and it's going to be wrapped up in May. Glad to answer any questions or write those questions down and have Mr. Taylor answer them for you when he comes back.
Tell me about the baseball field.
Yes, ma'am. One of the questions that's been asked is related to the lighting systems for the baseball field and the softball field. And when those prices came back, we realized that those prices far exceeded the budgeted prices for that for both the baseball field and the softball field. Inflation is a real thing, and we are dealing with that right now. We have asked Musco to separate those two projects, to itemize those two projects, and allow us to make some decisions, you as a board. We expect to have that data in February where you can pick one or the other. We don't have the budgeted dollars to be able to do one or the other. We would, of course, recommend rolling whatever project is not done into the second fiscal year, so it would pick up in July of 2022, assuming that it is an approved part of our budget process moving forward. But those are big ticket items right now.
How much, just ballpark it?
The baseball field ballpark was $500,000.
Oh, no. How many games do they play a year?
I
Same
couldn't
as
answer
the
that
other
question.
schools.
Sure. But we didn't pay for those lights on West.
Oh, yes, you paid for half of them.
On West, did we pay for half of West?
We did,
But we paid for the softball fields at North, or I mean
at west and at east, that's correct.
Listen, we didn't pay for those.
This is one of those
We
member
weren't on
boards,
this
boards in the
board.
past spent money.
Yes.
And what we want to be able to bring to you is we have committed to equity across our school system. And while that exists at 2 locations right now, we have 1 location that has no lights. We have 1 location that has no fields or lights. And so as we talk about moving forward, we want you to be informed about what that looks like. And again, when projects come in bid over budget, we don't approve those projects. We've asked for them to be revised in order that they can be considered by this board moving forward. So Mr. Taylor will be sharing that with you in February. Okay. Other questions? Thank you.
equity update.
Every one of my friends on the back row reminded me to keep it brief, so I will. All 3 of them.
I said Alabama, Georgia. Alabama, Georgia.
Okay, here we go. Removing barriers.
I'm gonna
Primary.
put you first next time.
Thank
Take as
you.
much time as you
Thank
want.
you. Primary goal of the Henderson County Career Academy. Yes, we would all agree. A primary goal is to remove barriers. I brought to you this summer the fact that we had received a grant, a 3-year grant, in the amount of $979,000. We just received access to those funds. So I want to tell you what our plans are and how we built that grant and what we can use that money to do. One of the requirements to be recipients eligible for and then recipients of this grant was that we work with an external partner. We have full confidence in RTI. They have done similar work to this all across the state, and we have worked with them. It's my understanding we've worked with them previously in the past and have been pleased. We are to establish annual goals in the areas you see here. We employed a 12-month IPG school coach. If you know Lori Chappell, she previously was with us as a career development coordinator, then went on to spend some time in the banking industry, came back to us, and just is thoroughly enjoying her role at the Career Academy. She and Shannon Otten make a powerhouse team. Talk about supporting students. The other requirement was that we use NC STAR for school improvement planning, and we use that district-wide, so that was not a barrier that we couldn't overcome. I wanted you to see that it was a competitive grant process, broken down by region. Cohort 2, there were 80 schools across the state eligible to apply for these funds. They all share some similar characteristics to our Career Academy, and 13 were recommended for funding. Our 3-year budget will include, and I just want to mention that there were specific areas that we were required to address. It wasn't just a blank check that we could determine how to spend in multiple ways, but the ways that we have expressed in the grant that will align to the grant initiatives are as follows. The IPG salary, coach salary and benefits, and then supplemental employment for staff if we want to bring the Career Academy staff in during summer months to work on particular initiatives. We will have funding to do that. The external partner contract, RTI, I mentioned earlier, employability skill development opportunities for students. And you all know what that opportunity will mean to our students. We can extend apprenticeship opportunities, shadowing internships, articulation with the community college. Barriers should not exist for any student to access those opportunities anymore because of these funds. Professional learning conferences, and then parent and family engagement. And RTI will help us with so many of those things, give us ideas, coach our staff. What I've appreciated so much so far about our work with RTI is they're not coming in to tell us what to do, but they're asking more questions than they're telling at this point, wanting to understand what our district's initiatives are and then how they can wrap their arms around and support us through that. A little bit more about Lori and her background and then what her job will allow her to do through these grant funds. She will be in classrooms working with students, engaging community partners, and if you know her, you know that is what she loves. That's just work that she thoroughly enjoys. RTI, if you're not familiar with them, I've just added a couple of slides to give you a little bit about their background. This international company just have a full bank of resources for us, both professional and otherwise. And the goals of RTI, just so you'll know a little bit more about them, and then you'll see this picture of the Career Academy staff. They are very focused on being in classrooms, modeling instruction, working to overcome barriers, removing barriers for our students. We have a coach assigned specifically to Career Academy, and as you might imagine, Christine Mukashe and her students rolled out the red carpet for the first meeting with Amelia Massengill-McLeod, our RTI instructional coach, who's assigned specifically to work with us. And then here's an example of working with a local business and industry. Mountain Credit Union was brought in to discuss beginning a partnership with them and things that they could offer to our students there. I could talk about that all night, but I'll get in trouble if I do. Just wanted to let you know this is where we have started, and I'll keep you up to date on what these grant funds allow us to do.
Thank you so much.
Thank you.
Do we still have that program that Ms. Haynes was in charge of, that the
Yes.
governor came?
Well, yes, and she got a big promotion. She's now over the whole state because she did such a great job. But we do the JAG program. We sure do. Yes, thank you.
All right, financial statements, Bernie?
Okay, two of them for you this month. Local current expense and other restricted through December 31. I'd like to report revenues received are $18,845,881, while expenditures are $15,013,629. And just as we talked about before, the bonuses coming up, those are coming out of federal and state dollars. They're not going to be impacting our local budget, and we are using the ESSER dollars to the extent possible to make sure that we don't have any local dollars to spend on those. And we are implementing the new salary schedules this month, which will then in turn impact our local budget.
What's that initial impact, that first hit when you have to pay back for the 6 months?
We're going to be calculating that as soon as we get through the bonuses. We'll begin that in February, along with our local retention bonus.
It's going to be a big number.
It will be.
And then we've got to make sure that we save enough for our payments that we pay in, June for,
The second part of the local supplement?
second supplement,
Yes.
Sorry, my
Yep.
brain is not. So it looks like we got a little bit of a cushion right now.
Absolutely, yes. And then the other report for you is capital outlay fund, as sort of goes along with Mr. Taylor and Dr. Bryant's report on the construction. We have received so far $905,572 in revenues, just on schedule from the county for our year, and we have spent $519,319, which ironically is very similar to what we spent last year.
Any questions? All right, general operations,
Thank you
Dr.
much.
Bryant.
Thank you, Mr. Craven. The general operations are simply just a couple of notes as it relates to our calendar for the upcoming month and moving forward. Again, remind everybody, following this week, we have optional teacher workday on Monday, required teacher workday on Tuesday as our semester flips. Remember, again, our 4x4 schedules are in exams this week. So again, thinking of our students, celebrating their successes as they wrap up some courses. Initial budget presentation, remembering, is next Wednesday. I'll share with this board when my time to present has been determined. Let you know when that's going to be. We'll be meeting together again in February for our regularly scheduled meeting on the 14th, touring Hendersonville Middle, East High, and Dana on the Wednesday prior. And then we have our early college calendar has an early release date on the 18th. Outside of that, that is all I have for general operations.
I want to, one thing to put on you two gentlemen's radar is something that Amy had asked me that we're not getting to today, and that's the substitute teachers and the qualifications. So I'd like you to bring that, if you guys think, I'd like that to be maybe an agenda item or something report that we can talk about to see if that makes sense, if we're going to get any persons, any more people from that, and bring that to our attention. Also, innovative high school sports. We haven't talked about it for a while. I want to see where we're at and make sure that we're discussing that. And these are a couple things that Amy brought up to me a little bit late than when we had on the agenda, but we've been here for 3 hours and 40 minutes, not including closed session. So
Mr. Rhodes is on both of those things and is prepared to come back to the board and share some elements as we talk about how we move forward. So, yes, sir.
If we did, if we could decide.
Good luck.
Well, yes, do you have an opinion on that?
As I shared with Dr. Revis and other board members, there are other school systems that are operating in that space. And I've shared with them, ultimately it requires some consensus around the board around what those levels are. And that has been the ultimate discussion. But should the board wish to have that kind of conversation, I certainly am glad to present and share other data metrics that can be considered, things like community transmission rates in school, number of students that test positive who are ultimately quarantined. Like, you could look at not just one metric, but other metrics. We've tried to look at a composite of them, but to your point, some school systems are looking at to inform the decision on a more regular basis.
Maybe on your return to learn type stuff, you can dig more into that type of thing. The positives and negatives of going to that type of, I've heard a lot of negatives about it. I've heard some positives about going to that type of metric system. We talked to some people down in Polk County, or I forget where they're doing it, Rutherford County. I was talking to some folks that were doing it, and how that's become kind of a runaway moving target now anyways. And so I don't mind having discussions around it at all. Yes.
It might leave some of the subjectivity out of it.
Yeah, I think everything's subjective. And so on that, I want to thank all of you guys. I want to thank all of you board members. We're going to get kicked in our teeth no matter which way we go every single month. I know that how hard this has been on a lot of us, and so I appreciate all of you. Thanks for what you do, and I'm here with you. So, thank you guys.
That would be the next time that you're scheduled to vote on it. Yes, ma'am.
All right, if there's no other questions, I will take my.
So that's what so she said we have to wear masks for the 14th? Is that what? Okay. I'll dig it out.
Oh, it's Valentine's Day. Yeah. We'll take
No,
cookies,
that's
please,
my
Stephanie. And
Granddaughter's birthday. I wish we went to
treats.
the meetings then.
Perfect. I'll take a motion to adjourn.
I move we adjourn.
All right, I got a first. Kathy, will you be a second? All right, all those in favor say aye.
Aye.
All right.